स्टेट हेल्थ सिस्टीम रिसोर्स सेंटर पुणे याच्या मार्फत आपण दर महिन्याच्या 3ऱ्या शुक्रवारी वेबिनार घेतो, जे आपले हेल्थ डिपार्टमेंटचे करंट टॉपिक्स आहेत आणि जे इंटरेस्टेड टॉपिक्स आहेत, ज्याच्यामध्ये आपल्याला असं वाटतं की मेडिकल ऑफिसर्स आणि हेल्थ ऑफिसर्सला अपडेट करणं गरजेचं आहे. त्या सिरीज मधला हा 4था वेबिनार आहे. आपण यापूर्वी मेजर्सच्या केसेस होत असताना मेजर्सचं वेबिनार घेतलं होतं. त्याच्यानंतर आपण कोविडची शक्यता असल्यामुळे कोविडचं वेबिनार घेतलं होतं आणि एक वेबिनार मलेरिया आणि फायलेरियावर आपण घेतलं होतं की ज्या विदर्भामध्ये केसेस आणि डेथ आहेत त्या संबंधी. आता त्या सिरीज मधलं आपण हे 4थं वेबिनार घेतोय की अपडेट्स ऑन पोस्टमॉर्टम सेक्शुअल असॉल्ट अँड मेडिकल केसेस, जे की आपल्याला कोर्टामध्ये प्रॉब्लेम येतो मेडिकल केस फेस करण्यासाठी, त्या विषयावर आपण वेबिनार घेतो. अंबाडेकर सर, मला आनंद होतो सांगायला की आता आजच्या वेबिनारसाठी जवळपास 915 लोकांनी रजिस्ट्रेशन सर केलेलं आहे. आपल्याला 915 लोकांचं रजिस्ट्रेशन इकोर दिसत आहे. मी सर आपल्याला विनंती करतो की आपण थोडंसं गाईड करावं, नंतर मग मी पण कंटिन्यू करेन. डॉक्टर अंबाडेकर सर पुणे.
ओके, ठीक आहे. मला वाटतं मला तेवढे माझ्या लिंकवर दिसत नाहीये, पण एनिवे खरोखर झाले असतील. अदरवाईज सगळ्यांचा महत्वाचा टॉपिक आहे, कारण आपल्याला नेहमी या गोष्टीमध्ये अडचणी येत असतात आणि आपल्याकडे बऱ्यापैकी नवीन वैद्यकीय अधिकारी जॉईन होतात. इव्हन काही PSC वरून ट्रान्सफर होतात, ज्यांनी मेडिकोलिगल किंवा PM किंवा अशा बाकीच्या असॉल्ट या गोष्टीमध्ये कधी काम केलेलं नसतं, है ना. आणि वी डोंट हॅव दॅट मच ऑफ फॉरेन्सिक एक्सपर्ट्सही आपल्याकडे तितकेसे नाही आहेत. आणि नवीन नवीन ऍक्ट आणि या सगळ्या गोष्टी अपडेशन किंवा सुधारित किंवा नवीन प्रत्येक गोष्टीचा ऍक्ट येत असतो. याच्याकडे लक्ष देणं, कारण शेवटी आपण क्लिनिकल सर्व्हिस देताना हा एक अतिशय महत्वाचा पार्ट याच्यामध्ये आहे. सो आजचं वेबिनार जे आहे त्याचा आपण सगळ्यांनी सगळे लाभ घेऊ. फक्त म्हणजे पॉइंट्स भेटताय म्हणून आपण जॉईन झालेलं नसतो तर खरोखर, कारण इतके 900 लोकांचं जॉईनिंग जे आहे दॅट इज म्हणजे खरोखर इम्पॉर्टंट टॉपिक आहे. त्यामुळे आपण याच्यामध्ये सर्वांनी चांगल्या प्रकारे लक्ष द्यावं आणि रुटीन मध्ये जे काही आपण काम करतो त्याच्यामध्ये काय डॉक्युमेंटेशन याच्यासाठी लागणार आहे, कशा प्रकारे हे लागणार आहे, हे सगळं समजून घ्यावं. कोणाला मला वाटतं काही ठिकाणी याच्याबद्दल तुमच्या प्री टेस्ट पोस्ट टेस्ट पण असतील, त्या थोड्याशा चांगल्या प्रकारे म्हणजे तुम्ही जर लक्ष दिलं तर आपण चांगल्या प्रकारे त्या टेस्ट देऊ शकू आणि त्याचा आपल्याला बेनिफिट होणार आहे. सो थँक्यू एव्हरीवन. मी जे काही एक्सपर्ट्स आले असतात त्यांचं पण धन्यवाद देतो की त्यांनी आपला वेळ काढून या वेबिनारसाठी दिला. आणि थँक्स म्हणजे SHRC त्यांनी पण हे एक चांगला उपक्रम चालू केलेला आहे की आपल्याला दर महिन्याला कुठल्या तरी महत्वाच्या टॉपिक आणि बर्निंग टॉपिकवर आपण ते नॉलेज आपलं अपडेट करणार आहोत. ओके, थँक्यू. विल कंटिन्यू. थँक्यू.
डॉक्टर HOD ऑफ द फॉरेन्सिक मेडिसिन GMC मिरज, त्यानंतर डॉक्टर मोहन पवार HOD अँड प्रोफेसर ऑफ द फॉरेन्सिक मेडिसिन PIMS दोन्ही, आणि डॉक्टर राजेश ढेरे प्रोफेसर अँड HOD ऑफ द फॉरेन्सिक मेडिसिन LTMMC कॉलेज सायन, हे तिघं आपल्याला लाभलेले आहेत. आपण पोस्टमॉर्टम आणि मेडिको लिगल केसेससाठी इन डेप्थ आपण हे सगळं वेबिनार अरेंज केलेलं आहे. माझी सगळ्यांना रिक्वेस्ट आहे की आपण प्री टेस्ट आपण आता सुरू करूया. प्री टेस्टची लिंक जी आहे ती चॅट बॉक्स मध्ये दिलेली आहे. आपण एक 5 ते 10 मिनिटं वेळ देऊया. सिंपल प्री टेस्ट आहे, फक्त 10 क्वेश्चन्स त्याच्यामध्ये आहेत. 10 क्वेश्चन तुम्हाला फक्त टिक करायचे त्याचे आन्सर्स. आणि सिमिलरली आपण ऍट द एंड ऑफ द डे पोस्ट टेस्ट घेऊन मी तिन्ही स्पीकरना रिक्वेस्ट करेन की पोस्ट टेस्ट झाल्यानंतर त्यांनी ते 10 क्वेश्चन जे आहेत ते इलॅबोरेट करावे, म्हणजे आपण त्या क्वेश्चनवर डिस्कशन घेऊ. तर एक 5 मिनिटं ते 10 मिनिटं मी आता वेळ देतोय. आपण प्री टेस्ट सगळ्यांनी सुरू करायला. येस, डॉक्टर बर्डाले सर आहेत? डॉक्टर बर्डाले सर
आहे सर.
थँक्यू. एक 5 मिनिटात आपण सुरू करूया सर.
डेफिनेटली सर.
येस सर. चे प्रश्न सोडवले असतील. नाउ विल स्टार्ट आवर वेबिनार. I will first introduce Dr. Rajesh Badale sir, who is a professor and head of the Department of the Forensic Medicine and Toxicology in the Government Medical College, Mirrors. He is having the experience 20 years of experience in teaching and medical legal cases. He has already published 105 research papers in national and international journals. So I will request Dr. Rajesh Badale sir to have his lecture on the sexual assault, examination of the victims and the collection of the samples. Dr. Badale sir.
Yes, sir. Thank you.
Yeah, thank you.
Good afternoon, everybody. Is I audible to everybody?
Yes, sir.
So today's topic is examination of survivor in sexual assault and what samples are to be preserved. Now the question is why we are taking this webinar. So what are our learning objectives? So a doctor should able to examine a victim or a survivor, then certify that particular case and preserve appropriate samples. Then to provide appropriate treatment. Now there are some problems with regard to age of the survivor, the consent, and whether what information to be informed to police. Then what are the duration of sample collection? Many times we have seen that the survivor report to doctor after a few days or few weeks. So up to what duration the samples should be collected. Then how to formalize a provisional opinion and a final opinion. And we will just review what are the guidelines which are given by Supreme Court of India. So we have frequently heard the term victim when we were MBBS, but now instead of victim we are using the term survivor. Now why this term survivor is used in a pro forma or the guidelines published by central government. Now the term survivor recognizes a person has the agency, she can decide, she can take decisions. Whereas a term victim is a person who doesn't possess an agency and who is not able or who is not capable to take decisions. So criminal law amendment which was done in 2013 has expanded the definition of rape, and now it includes penetrative assault. It may be oral, anal or vaginal, and now it recognizes the insertion of objects, weapons or a finger. Then second thing is inclusion of non-penetrative assault like touching a female, fondling or stalking. The most important thing is that this act recognizes the treatment of all survivors in the public hospital as well as private hospitals. The one thing is more important that failure to treat such survivor is now offense under the law. Now the law further disallows any past sexual history of survivor. Now the main point of examination victim is that you have to take history, then we have to obtain consent, then examination of clothes, then physical examination, and lastly collection of appropriate samples. So preliminary aspects. Now the survivor should receive all sort of treatment free of cost. Now this include OPD examination, inpatient admissions, laboratory examination, radiological investigation or urine pregnancy test and medicines. Now the casualty medical officer should label the case paper in case of survivor of sexual offense as a free, so that she should get free treatment. If the certain investigations or medicines are not available in the hospital, now the social worker employed in the hospital now will compensate that amount of money for the medicines or laboratory investigations. One more important thing is all copies of documents, including the treatment record, including the medical examination report, should be provided to the survivor or victim, and it should be provided free of cost. Now coming to history taking. Now, as far as possible, the history and examination should be conducted in a privacy. A separate room should be identified. Now record a name of a victim, address of the survivor, age and sex. Now we have recognized transgender also as a third sex. Previously we used to have male sex or female sex. Now with the enactment of Transgender Act, now the third sex is included as a transgender. And date and time of examination, the name of person who has brought the survivor. Obtain consent. Now, obtain consent is very much important because without obtaining consent, you cannot proceed for examination. If you proceed for examination without consent, now it will constitute as an assault. So, who can give consent? Any victim or any survivor who is more than 12 years of age can give consent for the purpose of examination. So, consent should be obtained for following purpose. One is examination. Second is for sample collection, for clinical laboratory or forensic science laboratory. Third is for treatment, and fourth is for information of police. So sometimes the victim or survivor may say that she may need treatment, but she don't want to inform the police. What are the protocols? We'll see later on. Now this is the format of consent given in that particular format, where you can identify four things. One is consent for medical examination, for treatment, yes or no. For medical examination, yes or no. Sample collection, yes or no. Now, it is also had a one line. I also understand that as per law, the hospital is required to inform police, and this has been explained to me. And one line is added. I want the information to be revealed to police, yes or no. Now, it is up to victim whether she want to complain to police or not. So, coming to examination of clothes. A note is made regarding the state of clothing. It should be mentioned whether the clothes were safe that were worn during the time of assault. If there are any freshly torn injuries or a cloth, or if any blood stains or smell stains over the clothes, now you have to mention the side color of the stains. Now you have to preserve these clothes. Now ask the survivor to stand on a large sheet of a paper. Ask her to undress herself. Don't try to remove the clothes because it will again amount to assault. So request her to remove the clothes. Now collect these clothes in a paper bag. Don't use any plastic bag or a carry bag. Now what happens? If it is collected in a plastic bag or a carry bag, it may happen that there may be contamination, and because of bacterial or fungal contamination, the DNA profiling will be different from the victims or survivors' DNA. So this is a photograph which is showing that the victim is, or that survivor is standing on a large white sheet of paper. Now she is undressing herself. Now collect these clothes in a paper bag. Don't collect in a plastic bag. Now this is a way in which we can have a nail scraping, or sometimes we need to remove nails. Now use the nail cutter for the removal of nails. Now this is a photograph which is showing how to collect the dried stains. Now these are the seminal stains. Now put a drop of distilled water with the help of cotton bud or a swab. Just scrap that particular stain when the stain becomes wet. Now this is a method how the smears are prepared. Now these smears are prepared from the stains found over the body, from the vaginal swabs, from the cervical swabs. So in this fashion, you have to prepare the smears. Now here we are putting the swab in a test tube. So what samples are usually preserved during such examination? So usually clothes and undergarments. So there may be chance that the seminal stains of accused may be found over the clothes of a victim. Then any foreign evidentiary material like hair or button or piece of fabric. Then you have to collect fingernail scraping. If the victim tries to resist the accused, then scraping from the suspected marks of stain like seminal stains or blood stain. Then combing of pubic hair. Here we are using the Lockhart's principle. Lockhart principle says that when two physical things comes in contact, they will exchange the things. So it may be possible that during the act of sexual intercourse, the loose pubic hairs from the accused may fall over the victim's pubic area. Now, by combing the pubic hairs, we are just collecting these loose pubic hairs in an attempt to retrieve the pubic hair from the suspected accused. So again, we have to collect pubic hairs of a survivor as a control sample, because the combing of pubic hairs may contain hair samples from the victim also and hair samples from the accuser also. So compare them, we have to collect the control pubic hair samples and we obtain that from the survivor. Then we proceed for vaginal swab. Then after taking swab, we prepared smears. Ideally, 2 slides should be prepared. Sometimes, if the facilities are available at a particular hospital, then we can have washings from the posterior fornix, just put a distilled water and collect the fluid from the fornix of vagina with the help of syringe. Then we usually collect blood either for blood grouping, secondly for DNA profiling, and third, if there is a history that a person has consumed some sort of intoxicant like alcohol, or while examining as a doctor you found that the victim is under the influence of alcohol, then and only then you have to collect blood for alcohol. Don't embark collecting blood for alcohol in a routine way. So usually we need blood for either DNA profiling or blood grouping. Then again, if there is a history of alcohol intoxication, then and then only collect urine. Otherwise, there is no need to collect urine. Now, if you found while examining the teeth bite marks or victim's body, then and then only you have to collect swab from that particular mark. If the bite marks are now not there on the body, there is no need to collect swab from the bite mark. So while collecting the samples, there are certain do's and don'ts. So never pack wet samples like clothes and the undergarment of a victim, because if you pack a wet sample, there is chances that there may be bacterial contamination or a fungal contamination. Now, if there is a bacterial or fungal contamination, so the bacterial DNA or fungal DNA may contaminate the DNA sample of a survivor or a victim, and the obtained DNA profile will be different from the original victim's profile. As far as possible, air dry the clothes. If you have a desiccator or a heat blower, then mildly you can use that to dry the samples. Now there is an exhaustive list of samples given in the pro forma. These samples should be collected, these samples should be collected. Theoretically, the sample list is exhaustive, but for practical purpose, collect only samples which are relevant. Sometimes there is a shaving of pubic area of a victim. In that case, it is not possible for you to collect the pubic hair sample. So write down your report that pubic hair samples not collected because pubic area was shaved. So only collect appropriate samples. We need to collect some samples for hospital laboratory. Blood for grouping and cross matching. Now this is only for treatment purpose and this is not for court purpose. Now this should be remembered. So what blood is collected for laboratory sample is only for grouping and cross matching, and this is only for treatment purpose. Second, blood for baseline tests like HIV or VDRL or HBsAg. And urine is collected for urine pregnancy test, that is UPT. Now recently, in January, the Delhi High Court had given directions to central government and the Delhi government that invariably in each and every victim or survivor of a sexual assault, UPT should be done mandatorily. Now this is a recent guideline. So treatment, it is mandatory to provide treatment irrespective of whether the hospital is a government hospital or private hospital. Now, if the survivor refuses consent for medical examination, sample collection, even in that case, you have to provide treatment. So, providing treatment is a mandatory. Now, age, consent, and information to the police. Many times, the medical officer working in casualty face this problem. So, survivor who is about 12 years of age can give consent for medical examination and sample collection. However, for treatment like MPP, the age of victim or survivor should be more than 18 years. So she cannot give consent for invasive procedure like MPP, where there is a chance that death may occur or some grievous hurt may occur. So if the victim is less than 18 years, then the consent of guardian or parent is must for the purpose of treatment. However, for purpose of medical legal examination and sample collection, the age should be more than 12 years. We will take one clinical scene. Frequently, we are seeing at my place, usually a 70-year girl reported to casualty with history of pain in abdomen. History revealed that she had an unprotected and consensual sexual intercourse with her boyfriend and had amenorrhea for about 2 to 3 months. UPT was positive. USG obtained showed about 10 to 12 weeks of pregnancy. So she don't want to inform to police her boyfriend in a trouble. However, she need MTP. Now the parent insists for police complaint and for MTP. Now what to do? Whether to do MLC or not, whether the matter should be informed to police or not, whose consent should be considered as a valid. Now this is a typical case. Now these are the youngsters usually of age 16 years, 17 years or 17 and a half years. And usually the things goes on casualty for hour or 2 hours. So what the guidelines says, now the page number 24 and 25 of the guidelines published by central government says that as a doctor or as a hospital, it is our duty to inform to police about a sexual offense. So therefore, it is mandatory on part of a doctor to make the case as a MLC. So you have to put the stamp of MLC and do the MLC. Now, in case of where the survivor says that she don't want to inform the police, she need only treatment. In that case, the request of that survivor should be documented. It should not be verbal, it should be documented at the time of MLC intimation to police. A clear note should be mentioned that informed refusal for police intimation. Now, it should be mentioned very clearly in that police intimation. The refusal of the victim or survivor should be respected. Now, it is a female or a one who can decide what to do with her body or what not to do with her body. Any doctor, any police officer, or any judge cannot compel a victim to undergo for medical examination and collection of sample. It is her will and wish. Therefore, we should respect the opinion given by that particular lady. Such informed refusal of examination, collection of sample should be documented. So only in situations where you need to start treatment because the life of victim is in danger. In that case, without consent, you can approach for treatment as per section 92 of IPC. Now, this section of 92 of IPC gives you immunity to proceed with a treatment without consent of victim. Now, in the above example, the female is of 17 years. Now, she don't want to inform the police, but need MTP service. However, the parents insisted that the police should be informed and should have MTP services. Now, what as a doctor should we do? So we should honor or we should respect the request of the survivor or victim. So it should be informed to police that informed refusal for police intimation. It should be documented. Now, for the purpose of MTP, you need to have a consent of parents. So appropriately obtain the consent of parent, do the MTP services. So that's the thing. So these things are very clearly mentioned in page number 24 and 25 of the guidelines. Now, what is the duration of samples which to be collected? Previously, what happens? Even the victim or survivor reports to hospital after 6 months, we used to collect all the samples. We used to collect pubic hair, we used to collect vaginal samples, cervical samples, smears, like that. However, these recently published guidelines have given a deadline or given a duration, up to what duration the samples should be collected. So if a female reports to hospital within 96 hours, that is about 4 days of the assault, all evidences should be collected, like collection of swabs, preparing of smear, collection of pubic hairs, like that. All these samples should be collected. Now the likelihood of finding of spermatozoa after 72 hours decreases. However, broadly, any lady who comes to hospital for examination and sample collection, all samples should be collected if the lady reports to hospital within 96 hours or 4 days. Now, it has been observed that the spermatozoa or sperms can be identified up to 72 hours. So, the sperms or spermatozoa can be identified only for 72 hours after assault. So, if a survivor or a victim suffered assault more than 3 days, so don't take swabs for detection of sperm or spermatozoa. Instead, take swabs for detection of semen, like for doing alkaline phosphatase test. Now here these two things are important. We usually collect swabs and smear for detection of spermatozoa. Now if the sperms are not detected, then we proceed for other tests like presence of semen by doing alkaline phosphatase test. So these two things are done. So initially it will try to find sperms or spermatozoa. If the sperms or spermatozoa are not identified, then we will go for laboratory test like detecting alkaline phosphatase. Now it is said that the concentration of alkaline phosphatase in semen is more than any other body fluid. So based on this finding, we will go for detection of alkaline phosphatase. So rough rule of thumb is that if a victim reports to hospital within 96 hours or within 4 days, then all samples should be collected. If the victim reports hospital beyond 96 hours, don't collect samples. Instead, write down in your observation that the victim has reported more than 96 hours or 4 days, and as per the guidelines given in the manual, page number 29, the samples are not collected. Now, evidences which are present outside the body, like for example, presence of blood or semen over a clothes, then it can be collected beyond 96 hours. How to form a provisional opinion? Provisional opinion should be immediately formed after your examination. Now, this provisional opinion is usually based on your clinical examination. So, I am giving just few examples. The list is not exhaustive. So, for example, if some genital injuries are present, the victim is having physical injury. For example, this is a tear at a hymen, a fresh tear at hymen at a 7 o'clock position or a 5 o'clock position with some abrasion over a body. Your opinion should be that there are signs suggestive of use of force. Now, why you are using use of force? Because you have observed some abrasion or contusion over a body. Plus, there is evidence of forceful penetration of vagina. Now, this forceful penetration of vagina, your opinion is based on the findings of genital injury. So, there may be possible that only genital injury may be there. There is no physical harm. So, in that case, your opinion should be that there are signs suggestive of recent forceful penetration of vagina, because here only genital injuries are present, physical injuries are absent. Now, it may be possible that only physical injuries may be present, but genital injuries are absent. So, genital injury absent, but physical injury only. So, can only suggest that a force has been used. The possibility of vaginal intercourse cannot be ruled out, or can say the vaginal penetration cannot be ruled out. Now, there are some cases where there is no injury to genital organs, plus there is no injury or a body. In that case, final opinion should be reserved pending for availability of science reports. Now remember here, as per these new guidelines, more emphasis is based on detection of semen or spermatozoa or alkaline phosphatase. So if the FSL report comes positive for presence of semen, then your opinion, final opinion should be like there are signs suggestive of forceful vaginal intercourse. So more emphasis is given on FSL reports. So if FSL report comes negative for semen, for example, if there is a possibility that there is intercourse, but intercourse is with use of condom, in that case, it is possible that no sperm may be detected, though there are fresh injuries. So in that case, either you can give opinion or sexual intercourse cannot be ruled out, or if the injuries are there, then you can use word there is a evidence of genital assault, like that. So we have two things. Recently, the Delhi High Court has given that in each and every case of survivor, the UPT test should be mandatory. And second, probably you people had been hearing this thing, two-finger test, also called as Parvajanam test. Now the Supreme Court of India has forbidden this particular test. Previously, what happens? Invariably or inadvertently, we usually examine the vagina and we just loosely write down in our case papers that one finger passes or two finger passes. Now, this has been prohibited by Supreme Court of India. So, in future, don't write your finger practices. So the Supreme Court of India says any person, that is doctor, who conducts the two-finger test or per vaginal examination is a contravention of the guidelines prescribed by the Supreme Court of India, and if found guilty, shall be guilty of misconduct. Means the matter would be referred to Maharashtra Medical Council, and Maharashtra Medical Council will take appropriate action against that doctor. So these are the two Supreme Court judgments. So one is recently passed in 2022, and second is original petition was filed in 2013. Now coming to last section of POCSO. What is the difference between examination of an adult and a child? Because for child we have a specific act called as a POCSO. So very few differences there. Just I will highlight only that differences. Otherwise, the examination part and lecture sample is same as like that of adult. Now, the medical examination of child or adult should be conducted as per the provision of section 164A of Criminal Procedure Code. So there is no difference. So in case of victim, if the survivor or victim happens to be a girl child, then invariably it should be examined by a woman doctor. Now it may create a problem at a centers where women doctors are not available. Now this is one of the gray area. Suppose at some rural hospital only male doctors are available and such girl child is brought, then what to do? Here the law is silent. So this is a gray area. However, the guidelines very clearly mention that if the victim is a girl child, invariably the examination should be conducted by a female doctor. No such medical examination should be conducted in presence of parent of that particular child. Because the child is new to doctor, new to the examination process, new to sample collection. So a parent or a guardian or a person in whom the child have a faith should be present during examination. Now, where such parent or such guardian or such person is not available, then the medical superintendent of that particular hospital or head of that particular hospital should nominate one female worker who is working in that hospital and ask her to present during that particular examination. That is the subsection 3, which says So this is all about examination of survivor, examination of child, girl child or male child. So just I have given the practical guidance. I have not gone for a very theoretical thing that how the female should be examined, whether speculum should be used or colposcope should be used, because that you will know better. So this is about the examination of victim, survivor. So thank you very much.
सर सर चॅट बॉक्स मध्ये काही क्वेश्चन्स आलेत त्याचे आन्सर करताय सर?
हो पाहतो सर.
सर क्वेश्चन दिसतात तुम्हाला चॅट बॉक्स मध्ये?
दिसतो दिसतंय.
येस.
थोडं एनलार्ज करतो सर मी.
हा. इथला पहिला क्वेश्चन आहे, व्हॉट इज द एज फॉर द कन्सेंट इन पॉक्सो ऍक्ट?
So invariably in POCSO Act, sir, consent of parent or guardian should be taken, because the child is usually less than 18 years. If the child is more than 12 years, then the consent of victim can be taken.
12 years. But 12 years is the boundary line.
Yes, 12
Below
years.
12 years,
That is-
consent is not needed or parents' consent is there.
Yes, sir.
And after 12 years, that girl can give the consent.
Yes, sir.
Yes. Okay, sir. Sir, next question, how to describe the hymen tear injury?
So usually the hymen tears are found on a 5 o'clock position, 6 o'clock position, or 7 o'clock position. It should be complete from the orifice to the base. So it should be declared as described as a complete tear from the hymenal opening up to base. Now it should mention whether it is a red, it has inflamed like that. In that fashion, you have to mention the hymenal tears.
Sir, specifically size, you should describe like that.
Visually, you describe that complete hymenal tear present on a 5 o'clock position or a 7 o'clock position or a 6 o'clock position. The margins are red, inflamed, swollen.
Okay. The next question is, what about the female patient age 17 in POCSO cases?
So that one I have given a clinical scenario, sir. After 12 years of age, the victim is capable to give consent.
Okay. Can you please post the PDF of the standard examination form?
Yes, yes, definitely, sir.
Okay. आणि पुढचा सर क्वेश्चन आहे, can we get the PPT or PDF of this presentation?
Yeah, definitely, sir. You can get it.
Yeah. Next question. Can you share the PPT again? Is it same? मला वाटतं सगळे जे पार्टिसिपंट आहेत त्यांना ऐकण्यापेक्षा पीपीटी घेण्यात जास्त इंटरेस्ट दिसतोय सर.
Okay, no problem, sir.
Okay. Where we can get, अरे Ganesh, where we can get more such important sessions. Okay. This for my mind. मी त्याचं उत्तर देतो की SHRC पुणेचा मी एक ईमेल आयडी शेअर करतो ऍट द एंड ऑफ द डे. आणि सगळ्या पार्टिसिपंटना मी रिक्वेस्ट करतो की तुम्हाला जे टॉपिक्स पाहिजेत which you are more interested, you just mail to us, so we can start adding these topics in the coming sessions. Okay. Why called survivor in spite of victim? Right? Okay. Sir, हा क्वेश्चन तुमच्यासाठी आहे सर.
Survivor
in spite of victim.
Because sir, it is said that the survivor have an agency, means she can decide whether what should be done with her body or what should not be done with her body, whereas in case of victim is a word which is like a stigma. So usually, what as a person, it is said that she cannot decide what to do with that, whether he will be going for medical examination like that. That's why in slide second and third, I have made the difference. What is survivor and what is victim.
Okay. Next is please send this. अरे मला वाचताना हा का वरती करतो? Please send this presentation in our email. मी सगळ्यांना रिक्वेस्ट करतो की माझा at the end of the day SHRC चा ईमेल आयडी मी देतोय. ज्यांची रिक्वेस्ट त्या ईमेल आयडी वर मला येईल त्याला बॅक टू बॅक पाठवलं जाईल. सगळ्यांना नाही. SHRC च्या ईमेल वर तुम्ही रिक्वेस्ट पाठवा की आम्हाला कुठलं प्रेझेंटेशन पाहिजे. We are happy to share it. What samples are to be collected during the above examination? हा
During sir?
क्वेश्चन कोणी लिहिलाय? प्रशांत बर्वे. What samples are to be collected during the above examination?
Sir, during examination, sir, that's why I have said what is clothes and undergarments for the presence of semen or any blood stains. Then vaginal swab, vaginal smears, cervical swab and cervical smears. And if any other dried stains present on a body, then you have to moist that stain with a distilled water and collect with the help of swab. So majorly these are the samples. If loose pubic hairs are there, then you have to just comb that loose pubic hairs, collect that loose pubic hairs in a one packet, and then as a control, just clip or cut the pubic hair of victim for control purpose. So roughly there are few samples which usually we collect.
If no physical or genital injury and FSL negative, how will you give opinion?
The possibility of sexual offense cannot be ruled. That is the only thing which we give.
In POXO victim, exam above 12 years, what if child consent and parents not?
In that case, madam, madam.
And what if parents consents and child not?
Okay, दोघांपैकी एकाने दिली एकाने नाही दिली. Either way.
That's why I was saying if the child is more than 12 years, then the consent of child is valid for examination, medical legal examination, sample collection. However, for treatment purpose, the age of child should be more than 18 years. ह्या दोन गोष्टी आहेत. नाउ एक एक्झाम्पल घेतलं आपण की 13 वर्षाची मुलगी आहे. She denies consent and parents gives consent. So what to do? So if the child do not give consent for medical examination, then record that denial in the form, obtain signature. So you can't proceed without the victim's or child's consent.
What is the age group for a survivor to be booked under POXO Act?
It is less than 18 years. Any girl child or male child who is less than 18 years is covered under POXO.
Amendment 2020 POXO Act.
Hmm.
And next.
I have not got your question.
सर 2020 पॉक्सो ऍक्ट मध्ये काही अमेंडमेंट आहेत का? तुम्ही जे सांगितलं त्यानुसार?
नाही, माझ्या माहितीप्रमाणे तर काही 20-30 मध्ये काय नाही एक्झॅक्टली मला तरी माहिती नाही सध्या तरी.
ओके, ठीक.
Girl is married before 18 years and pregnancy at 18 years, then is it mandatory to inform POXO?
Yes, it is mandatory to inform police. Now it is up to victim whether she want to make FIR or not. But if that behavior is less than 18 years, now it is our duty to inform the police. So it is up to police whether they will register under POCSO 76 like that. It is dependent upon police.
Should vaginal sample be collected if the survivor presents after 96 hours just to detect the presence of semen?
So the guidelines very clearly mention that after 72 hours, the spermatozoa cannot be detected. However, between 72 hours to 96 hours, you can preserve the swab for detection of semen. After 96 hours, there is no guarantee that semen that semen may also be detected. That's why the 96 hours guideline is very clearly mentioned. Whereas previously it was not there.
Need video of sample collection. Do we need
Do we?
the video of sample collection?
That depends upon the consent. If the victim gives consent for video recording, then you can record the things. If the victim is ready for photographs, you can take photographs. That totally depends upon the consent of victim.
If age is not assorted, what do we do?
If age is not
Assorted.
ascertained, if you are not sure about age,
Yeah.
so that POCSO Act says that the birth certificate is authentic document followed by living certificate. So if these two things are not, then the age estimation can be done by radiological examination and physical examination.
Examination of male or female child is examined by a registered practitioner, not mentioned female doctor registered practitioner.
As far as I know, that amendment has clearly mentioned in POCSO Act that female child should be examined by female doctor.
Survivor in POCSO cases come after 4 days, then you will not take any sample, right, sir?
Yeah, definitely.
Examination guidelines for male victim in POCSO.
The same guidelines holds true because there is no separate format provided for male. The guidelines provided by central government is for adult survivor. So no specific format was provided for POCSO. However, we are using the same format for POCSO cases also. So that is a gray area.
Patient comes for delivery.
Yeah. Patient comes for delivery.
Okay. If parents not giving consent, then what?
So patients come for delivery. What is the age of patient?
So that question was, I think, incomplete. We can go to next one, sir.
After 96 hours.
No, madam. I'm not getting.
So that
What
question, I think they have put forth is very incomplete. So we can go to next one. If parents not giving consent, then what?
The parents not giving consent for MTP or pregnancy delivery.
General.
No, in general, this is another
Another
question.
तर मध्ये एक पहिली सर
हा.
सर की
हा.
आपण मध्ये जो बोलत होतो विषय 2020 ऍक्ट जो आहे अमेंडमेंट जे आहे त्यात
हो.
मला असं वाटतं की इन्स्टेड ऑफ द फिमेल मेडिकल ऑफिसर इट इज
हा.
नाउ द रजिस्टर्ड मेडिकल प्रॅक्टिशनर
असेल एवढंच. हा, याची मला कल्पना नाही सर एवढं.
आय थिंक सो
असेल कारण अमेंडमेंट एवढ्या झाल्या सर प्रचंड आता एवढ्या मे बी असाल तर माझ्या सुटली असेल एक पॉसिबिलिटी आय कॅनॉट से.
नाही, वन ऑफ द फॉरेन्सिक पर्सन हॅज इन्फॉर्म मी जस्ट नाउ ऑन माय व्हॉट्सअप. आय एम नॉट एक्सपर्ट.
Maybe sir, maybe just I will see it and I will confirm. I will at the end of this session I will let you know.
Yeah, definitely.
हाँ, sir.
So next question.
After 96 hours, which sample is mandatory to collect?
Only that blood sample is there, madam, because the swabs and smear, it has not to be collected. Only
What do
remains
we-
a blood sample.
What do we do if survivor is menstruating at the time of examination?
It is said that you should mention in the report that the survivor is menstruating, and at the end you advise report after the period is over, and then we will examine immediately after that.
How the opinion is given after the exam?
Please elaborate various
Opinion,
opinions.
sexual assault.
sexual assault.
ठीक आहे ते मध्ये नको आणू हे. ते मध्ये काय आलं?
If age less than 12 years of a girl, then her statement is taken into consideration or not?
That statement I will not able to comment, because that the taking statement is a police work. As far as a doctor we are there, if the girl is less than 12 years age, she cannot give valid consent. That's what I can tell right now.
Okay.
If no physical or genital injury came after 2 months of assault, how to give opinion?
That's the one of the gray area, because that new guidelines most of the time you emphasize or forensic science laboratory reports rather than medical examination reports. So they rely more on FSL reports. So we cannot do much in such cases.
In PHC level, where there is no female doctor, then what should we do about medical examination?
They are just answered.
Just now answer.
Any registered medical practitioner can examine.
Please tell about examination of accused too.
Examination of
Accused.
accused, no examination. What the Ministry of Family Family Welfare and Health have not given any separate format for examination of accused. So we will proceeds accused in the same fashion that of like victim. We will examine the clothes. Initially we will obtain consent. Then we will we'll record the history. We will examine the clothes, and then we will examine the body for presence of an injury, and we examine the private parts or genitals of that particular accused. And then usually we take in fresh cases, we usually take pubic hairs as a sample, and second blood sample.
There is no need to take the semen
No,
sample.
there is no. In fact, the forensic science laboratory or home minister had specifically given a circular that no semen should be sent to forensic science laboratory from the accused.
Okay.
I can share that to the email which we will be giving to me. The circular I will share.
Yeah.
Forms.
Next.
Time period limit of 96 hours for collection of biological sample in case of victim is applicable for samples from accused.
There is no guidelines for accused. Now these all guidelines are given only for survivor.
Next.
Age below 18 years delivered is it mandatory to inform? Yeah, it is. Right. Where examination to be conducted of POSCO cases only in medical college and civil hospital not to be examined in RH or SDH. Please open.
I am not aware about such guidelines. It is said that it should be examined by registered medical practitioner.
We all are registered medical practitioners.
Yes.
चला, वाचा.
Repeat of that.
मैं वाचा में repeat नहीं. SHRC email ID having sending after the end of the webinar.
Definitely, sir. Definitely. I will.
So, yeah. So be there. I am talking to participants, sir, not for you.
Sir has answered
Answered about this question.
Sir, it is mandatory to the ultrasound of the victim.
For pregnancy, it is mandatory, but for routinely, it is not mandatory unless there is history that there is a trauma or abdomen.
Please share video of ideal process of sample collection of vaginal and cervical swab on email.
Yes. I will share the video, the email which I will be getting. I will share that video.
Should every unmarried below 18 years willing for MTP be informed to police?
Yes, since she is below 18 years, it is mandatory to inform police as per POCSO.
It is it.
reform given by
Central government is saying.
Okay, so whether proforma given by central government is same for natural and unnatural sexual offending cases.
It is the same format for natural and unnatural. Same format. Natural, unnatural include that anal and oral also. The same format we have to use.
What is used for examination?
Pardon, madam?
It's consent. See, already, this question is already answered. I think now questions are, repeating and they are repeated questions, so maybe we can do.
Repetition of the question is there. Sir, can you be with us till the end of webinar? Or you are in hurry?
Yeah. For panel discussion, I will be there.
Yeah. I will request if any questions are there, we'll have the final answer. Sir, thank you very much for joining the webinar to address all medical officers, the needy medical officers who require the knowledge across the Maharashtra. I once again thanks from the SHRC Pune, Dr. Badan sir, thanks. Now our second session of the webinar, I would request Dr. Mohan Pawar, who is the HOD and the Professor, Department of Forensic Medicine and Toxicology, PIMS Loni, Ahmednagar. He is not only MD Forensic Medicine, but he is also advocate. He is LLB too. He at present is a professor at the PIMS Loni. He has 11 national and 8 international publications under his arm. He graduated and post-graduated from the Vasantara Naik Government Medical College, Yavatmal, and having the post-MD experience of teaching of 18 years. I am very quite delightful that he worked as a medical superintendent at the rural hospital in Buldana district. म्हणजे आमचे दुःख काय सर तुम्हाला माहिती आहे शकतात, त्यामुळे आम्हाला आनंद वाटला. Presently, he is chief coordinator of International Quality Assurance Cell of DBVP RMC Loni. I request Dr. Mohan Pawar sir to have his final words on the difficulties faced by the medical officers in conducting the postmortems and their solutions. Dr. Mohan Pawar sir, please.
Very good afternoon, sir. Am I audible, sir?
Yes, you are audible, sir.
And my screen is also visible there, sir?
Yes.
So at the beginning itself, I want to congratulate Dr. Deshmukh sir and SHRC Pune team for really conducting and starting such sessions for all the medical officers throughout our state, and you can see the number of participants. It's almost 382 participants, sir. So because all are in need of such an innovative knowledge, the latest amendments, the Bardare sir has very nicely touched each and every point of the sexual offense cases and POSCO cases and their examinations. So I am here to begin yet another important session, as sir conveyed me, to be dealt on difficulties by medical officer in conducting postmortem examinations. And we will try to find out their solutions through the discussion itself. Sir, I am happy to share that at the beginning, after receiving your invitation, I had circulated a Google form which actually invited the various inputs and the messages from various medical officers throughout our state. And let me share with all of you. So what I did, so the medical officers, almost 79 people participated in that Google form, though the number was lesser, but you can see all of them are medical graduate, postgraduate degree, diploma, and even some specialists were there. Their working headquarters were primary health center, rural hospital, sub-district hospital, likewise. And as sir correctly said that I know how the difficulties are faced by the medical officer at various stages. I have seen it being at a rural medical center there in the Buldana district. Even I was there in Dharni also, sir. Both of them were rural hospitals. The experience were from, 41% of the medical officers were between 0 to 5 years of experience, but most of them, even 27% of more than 15-year experiences have shared their witnesses. And most of them were conducting the postmortem, though very less number, like, the 55% of the people, they were having the experience of conducting postmortem reports. 69 percent of the people worked where in the rural hospital or their hospital setup has got mortuary. Sir, it is very neglected part of the postmortem work that sometimes the primary health center or our medical setup has not got the mortuary there. And that's the reason why our medical officers are not conducting. If it is available there, they thought that the condition was not of that good quality. So I appeal through this platform that it should be looked with the same intention as if we are maintaining other part of our services, that it should be very well maintained throughout the year and through the services. The issues related with non-maintenance was quality of infrastructure. It usually being available very far in the compound of that primary health center or rural hospital. That itself is a difficult part for a lady medical officer or our other medical officers to go there and see, because the maintenance is not there. Some of them shared that the water supply or electric supply is not available. I consider this itself as one of the difficulty that our medical officers are facing. I am coming to the actual autopsy procedure later on, but come to the basic points what we are really need to work on. And its maintenance, availability of necessary equipments also is one of the factor. So most of them, after availability of the mortuary setup there, they are conducting. Only few of them are not conducting. So most of them, after their graduation, they had not trained in the medical legal autopsy works. Only thing during their tenure of the undergraduate, they used to attend medical uh, college for the medical legal autopsies, and they are not much exposed to the actual practices. So suddenly, whenever they are getting their degrees and the postings, uh, our officers are asked to conduct the postmortems very similarly to the other procedure. But as it is a specialized area, it needs some training skills to be adopted. So that's why it is said that only 20% of the 79 participants, they got some training of one or other way, because some of the participants also were from the forensic medicine background. So that's why we are getting this 22 point percentage of number. So mortuary attendant, most of the time we have to search for the attendant. We have to call him and get the work done. So if it is available or appointed, he also is not trained. He's doing on his own. And most of the time, the procedure may not be to the mark. So here also the 77% said that yes, our attender, and that too who is conducting the postmortems, who is actually assisting the postmortem examination, is not of
Sir,
trained.
I would like to interrupt you, sir.
Yes, sir.
Have you started the presentation? Maybe because we cannot see the presentation. It is not visible, sir.
I will share, sir.
Yeah. Yeah, it is now visible. If possible, make it a full screen. Now it is visible.
Okay. So most of the time, our medical officers are also referring the postmortem related cases, and see the referral percentage is up to 58%. 58% people said that they are not referring, they are doing it there. But see the reason why they are being referred. It is almost the humiliation for the relatives and even the police officer to take the body from such a place to another. The reason for referring was unavailability of the mortuary. Attender has to be searched for, which is not a regularly appointed one. Sometimes the complicated cases are being referred, and sometimes the relative themselves demand that they want to refer to the another center and not to be done here. So the crowd and law, sometimes also situation will make the medical officer to take such cases to the other center. So these are the actual root level problems our medical officers are facing. The difficulties we can talk one by one are as follows. They are randomly being shared. So they said that sometimes the dead body carrying van or vehicle is not available, because most of the time they have to conduct the spot PM, sir. And insufficient experience is there. That's why I said they are not exposed to or trained with the skills of conducting postmortem examination. They need forensic medicine experts for their guidance, and sometimes skilled or lack of training for the medical officer as well as their attender is the reason. Guidelines were not available sometimes for them, because we never know what kind of case will be coming. So exhumation, if it is ordered, And if the medical officer want to attend it and want to do these further proceedings, they are unaware. So in such cases, they used to face the difficulties. Till now, the government has not made any survey of post-mortem related facilities available at various centers. So that is the need to update our medical legal services at the root level. Upgradation of mortuaries also is a matter of fact. Peripheral centers don't have the doctors available. They said appointment and training is the issue. Then don't know what kind of samples are to be preserved. And sometimes the available material is insufficient or it is not available at all. So in that conditions, they are unable to preserve the needed samples. And some of them are not exposed to the medical legal autopsy at all earlier. So they don't have the experience. And the regularly appointed attendant can come sometimes for assisting the medical legal autopsy, but the person who is not regularly being appointed will show sometimes the resistance, and lack of manpower is there. Sometimes because of the court call, the doctors are facing difficulty, and newly appointed doctors sometimes may resist for attending the court, because in such medical legal autopsies, they know that they may get the summons. Lack of forensic medicine experts nearby or at the center is the reason. They said DNA samples are very difficult to preserve according to them, because sometimes bone, if it is to be taken out, the cleaning, maintaining, keeping it, preserving and sending, it is found difficult for them. And no attendant is available, so no chance or no choice is left for them. So these are the difficulties. In short, they had shared with us. Most of them are lack of required instruments, availability of skilled mortuary attendant, the experience, complicated cases are like this. So I will come to one by one. The mortuary location, it itself is given such a place in somewhere corner which is not electrically well connected, water supply is not there, inadequate space is available, because quality of infrastructural construction is very poor, and because the work is not being regularly done, it is not maintained in a good conditions there. So the infrastructure itself becomes one of the reason to work in such a situation there for our medical officer. So one has to take the lead. The whoever in charge of that primary health center or rural health center should take the lead to keep our mortuary a good maintained type of working place, so that even on a Sunday also, if such a case will come, the hospital will be in a position to conduct it, not because the it is a holiday or the attendant is not available. So it is our responsibility to maintain it, to look after its proper maintenance. The facilities sometimes, yes, if relatives are not coming and they are from the far away places, sometimes the hospital may not have the cold storage facility. In that conditions, if the body is kept for a whole night, sometimes in a summer season, body may start decomposing. And in such case, on the next day when the relatives approaches and arrived, the body will show the different features, whatever has included in the inquest earlier. So lack of lab services, because one has to do some tests there, one has to preserve some samples, those basic sample preserving material should be available. If it is not available, then our medical officers will be helpless to preserve it further. In firearm cases or in cases of a skeletonized body, decomposed body, unidentified body, it is always suggested that the ready imaging techniques are to be adopted, like taking X-rays to know any age-related findings, the implant-related findings, so that identification can be done. And of course, inadequate manpower and again its maintenance of the facilities is a matter of question. The staff, medical officers themselves are not trained, especially in a medico-legal autopsy work, because even any medical officer has to do the tubectomy, vasectomy, MTPs. They are being trained accordingly. This is inevitable, regularly to be conducted. Such work has to be given the importance by arranging the various workshops, trainings, so that they will come to know what things are to be looked after in the medical legal autopsy, what are things to be seen, things to be noted down on the paper, things to be dealt whenever the summons will be there in such medical legal autopsies. So everything will be needed there, and that can only be possible after the specialized training for all of our practitioners. So coming to the autopsy as such, yes, one has to see the inquest, whether the police has given a proper inquest or not. Requisition is there in your name only, and whatever the injuries mentioned in the inquest, they are correctly mentioned or not. Verify it by examining the body, taking the inquest in your hand. So external examination will see the head to toe examination from apparels that are cloths. Cloths, see each and every cloths, whether they are in a good condition, soiled, torn, blood stains, mention it. You never know what the case is. Usually in cases of the broad dead cases, one has to be more conscious. So external examination, not only the examination of the body, but the cloths and apparels itself. Then after noting down the conditions of the body, whether status of the eyes open, mouth, whether the froth is there, whether any oozing is there, blood stains are there or not. Minor injuries you may miss, but that has to be noted down. External examination is important from conclusion point of view, wherein you have to find what is the time since death, because the rigor mortis, which is nothing but the stiffness of the body, which you have to mention, whether it is present in the neck muscle, jaw muscles, or neck, or upper limbs, or lower limbs. Accordingly, you can state whether it is partially developed, well developed, or passed off in the various parts of the body. Second is the livor mortis, that is postmortem lividity. So external examination will be including these features in addition to the injuries. Injuries will be the important from point of the notings of 17 column. This 17 column carries very more important weightage. You are mentioning each and every injury there, their size, shape, site, and the color, which tells the, or which depicts that it is because of particular weapon and has been caused this much time before, whether it is internally leading to any further damages, whether the death has occurred because of particular injury or not. That's why mentioning the injury in detail with their specifications is needed. Next columns comes as an internal examination. Palpation also you have to palpate whether any fracture is there, dislocation is there, that you have to note down in the next column of 18. And internal examination will have to be targeting all the three body cavities. What are those cavities? Are the cranial cavity, thoracic cavity, and the abdominal cavity. Open all the cavities in all possible cases. And it is very important in broad dead cases that you should search for any minor injury. Sometimes the snake bite or electrocution marks, these are minor injuries, and you may miss, or even the police officer may not be knowing. Most of the time, what is happening, our MOs are following whatever is mentioned in the inquest. But beyond that, one has to think. Your observations, your notings, and your findings carry much more importance than the inquest. No doubt, all those inquest, our autopsy report will be corroboratively thought of by the honorable court before giving the justice on. But still, our own findings has to be properly mentioned throughout the external as well as internal examination. Interpretation should be proper, whether this is blood, this is decomposition fluid, or this is exudation, or is it an injury or livor mortis. Differentiation is a proper. It is a matter of practice. It can't be possible with just saying or attending such seminar, but certainly you will get the guidelines what to do or what not to do. And lack of exposure and training also will lead to difficulty of the autopsy as such. So the basic thing, you may be knowing that after the body is being laid down on a flat surface, the blood circulation stops and it will get settled on the dependent part. We are knowing only one concept, that the postmortem lividity will be there on the back and buttocks. No, sometimes if the person is lying down in a prone position and after death he was there in same lying down position or prone position for more than 6 hours, the postmortem lividity, what is shown here on the photo, will appear like this on the chest. See, in this situation, it is the rigor mortis, how the upper limb, both sides, it is flexed, one is flexed and another is extended. And you can see the bluish coloration on the anterior aspect of the body. So his body was in prone position, so it was showing like this. See, in these conditions, his left forearm was flexed and was over the chest. But after removing this, can you notice the pale color is seen there, and all those reddish purple color is the postmortem lividity, because he was on prone position lying down there on the surface. And this is a pale area wherein his hand was in that position. After removing, it was noted that it is pale. What is this? Is nothing but a contact pallor. It tells that the blood was not accommodated there because of the pressure of that flexed hand or the chest. It got compressed with the surface and the chest wall. So contact pallor also you are supposed to know. You should not think or interpret this bluish purple color as if it is a contusion or any blunt trauma. In this situation also, you can see the reddish fluid oozing out from the nostrils and mouth. You may take it as a bleeding through the mouth, but it is the decomposition fluid. you can see the changes of decomposition, and accordingly, this decomposition fluid will ooze out. You have to rule out the other possible conditions. Body will be seeing with ballooning effect, the distended abdomen, distended scrotal sac, the eyes will be protruding out. So likewise, some decomposition gases will be taking the place at various sites, and fluid will be oozing from natural orifices. In female, sometimes it will be oozing from the genitalia also, the vagina. So you may take it as a bleeding, but one has to see meticulously. Further decomposed bodies will be brought for medicolegal autopsy. Some of you share that even in such decomposed situations, you have to conduct the autopsy there on the spot itself. Yes, it do happen. And because you said no availability of the vehicle for the police department or from the health department, that also is one of the reasons for conducting the autopsy there at the spot. But it is always better to request them to bring the dead body at the center, because you can do many more other things like meticulous examination, preserving the samples. The facilities will be available. You can't carry all the instruments there at the spot. So it's always better to request them to bring to your mortuary if it is available. So such kind of decomposition features will be seen, wherein identification itself will be one of the difficulty. So noting down the body parameters like height, features, though the epidermis will be peeled off, sometimes the tattoo mark will be noted on the dermis. You have to mention it. Count the teeth if the teeth are in good number as it is shown here. You have to take X-rays so that the age estimation as well as the any implant, if it is available, you can trace it. Then sometimes such peeling of skin, we wrongly took it as abrasions, injuries, but see, it is a feature of a putrefaction or a decomposition. All those changes of the decomposition are to be mentioned in the column of if any decompositions are there in external examination or not. So in this case, the peeling of body, the marbling, the distended abdomen, decomposition fluid oozing, if you can see the scrotal distension is also to be mentioned in that column, so that you can come to know how much time has been lapsed after the death. You said that exhumation sometimes is a case wherein the whatever bones or body mass is available, tissue mass is available, will be brought. So one has to arrange it in a anatomical knowledge so that you can at least come to know which bones are there, any injury, major injury can be seen or not, whether it belongs to male or not. So that can be the interpretation in such cases. Injuries is our main concern during external examination. You have to differentiate whether these are on the accessible part of the body, whether this is single in nature or multiple. So suicidal nature is with an accessible part. If one person is holding the weapon and causing the injury, it will be possibly on the accessible part. And multiple injuries, that too, the fatal injuries will certainly be homicidal. Accidental injuries will appear at any of the part of the body. Graze abrasions is the commonest one. Sometimes lacerations leading to the direct impact on the hard and blunt surfaces of the vehicles is the injury. Homicidal injuries are severe injuries. Brutal injuries can be categorized specially as a homicidal one. usually these are the surfaces and even the forearm, anterior part of the forearm, where the person will try to defend, and defense injuries will be noted down. If it is an axe, sword, or a chopper, chop wounds will be seen on the surfaces. Fabricated wounds are the injuries which are exaggerated or added injuries, and those are again on the accessible part. These are nothing but the suicidal injuries only, but the person has added to whatever injury he or she has sustained earlier, unintentional. After holding such a weapon, the person may get the injuries on his hand. This will be helpful in noting down whether the injuries caused to other part are homicidal or suicidal. Because in cases of wrist cut injury, if he is cutting and hesitation cuts are there, the person will also has got the unintentional injuries on his other hand, wherein the weapon was used. So though these are minor things, your observation during the medical legal autopsy and noting it down in the postmortem report will give you not only the guidance towards opining whether it is suicidal or homicidal, but it also certainly gives you satisfaction that you did a wonderful job. So seeing to injuries, as I said, if the injuries are very minor, you should not miss, because you never know that this minor injury itself is the result of the death. It itself is the fatal injury. Like can you see in this photograph, the injuries over, see the neck, and those are concentric or semicircular kind of, these are matching with our nail scratch marks. So these are the throttling injuries. Even in cases of smothering, the ecchymosis or the contusions beneath the lip, mucosal surface of the lip will be the injuries. In cases of, say, homicidal and suicidal cutthroat, yes, as we said, that the person will be hesitating and causing multiple injuries. You can see these multiple injuries, and see the deeper and the injury without the hesitation cut is a homicidal one. One injury, person is dying there. Most of the structures or the neck are got injured, damaged, cut, and the resulting into the excessive bleeding and further death. On the wrist, you can note down multiple other parallel incisions. Those are hesitation cuts. Those are the injuries in addition to the major wrist cut injuries. You can note down there. The fabricated injury, as we discussed, are additional injuries. See, we can easily say that yes, these are the homicidal injuries. And what are these? These are nothing but the stab injuries. The you can see the waist shape, their angles are there. One angle is acute. You can see these are the acute angle. This is blunt angle, acute angle, acute angles. Likewise, even the intestine is protruding out of these stab wounds. You can see the multiple stab over the left side of the chest. The person may be knowing the anatomy of the heart there. So he has targeted the heart on that incidence. See the angles. Can you see these angles? And these are the margins. These are again the stab wounds. How characteristically it is placed there over the body. It has got a tract. It has got a direction also. It can tell which internal injuries are further damage, causing damage to the internal organs. You have to see the bleeding inside. That's why I said, if your hospital is well equipped with the portable X-ray machine, whenever such case will come, you have to take the X-ray. You never know that the part of the weapon. Sometimes you may get in firearm cases, your main intention is to trace the missiles, maybe the pellets, wads, or the bullet from the body and to preserve it for ballistic examination further. So in this case, can you note down this radio opaque shadow there? And you can see that it was missing. So those are the correlative findings, corroborative things are needed with your meticulous observations. In cases of firearm, which usually not been done at the centers like primary health center, but the other medical officer has to get the exposure, whether it is a contact shot, whether it is a close range shot. So close range will have the dispersion of the burnt unburnt gunpowder, damaging the entry wound. See the burnt unburnt gunpowders there. Distant shot will not have that flame, gases, or burnt unburnt gunpowder. And here it was because of the rifled firearm weapon, that is bullet. You can see the color, blackish color, which is nothing but an abrasion color surrounding to the main firearm injury. So injuries description, the identification sometimes itself is a difficulty for our medical officer if you are not looking to it with your curiosity. Clean the surface, see it properly, see its color, the situation, mention the dimension, because this dimension only will help us to opine about the weapon which may be brought in future for examination purpose. See, the same injury was shown with is shown with the magnification. Here is a distant shot with a shotgun firearm weapon. Can you see this? This is nothing but a pellet. Though pellets are impacted in the dummies, and here pellets got attacked and fallen down and resulting into the injuries like this. This is multiple pellets have struck to the body, resulting into such an injuries. Internally, the tract of the wound in cases of fire matters. It's that from where the fire.
बाळाला घेत नाही मी त्याला आधीच सांगितलं बाळाला गरम कपड्यांचं काही आधी का सांगितलं
Please mute your mic. Somebody open the mic. Please mute.
Not to worry, sir. Our officers are on duty. It can very specifically stating the scenario that our officers are there in the OPD itself. It happens, sir. But see the dedication, they are attending our seminar, which you have taken the initiation.
Very, very positive step.
Yes, sir. Take everything positively. Sir, here you can
खरं तर हे आधीच चालू करायला पाहिजे 2 महिने अगोदर 2000 सगळ्याला हे दोन कंटिन्यूअस असतात
किरण कुमार
ही घरी का ठेवायचं आपण रात्री पळत रडली तर हे टाकायचं जास्त रडली रात्री पळत गाडी घेऊन जाणं हे जाणं किती पैसे खर्च होते त्याच्यापेक्षा हे परवडतं हा इथे किती कमी नाही तर टाकायचं ही आता पाजवल्यावर तुला सर्दी तापमध्ये हे पुन्हा महिनाभर चालतं
Dr. Kiran Kumar.
So finding out this kind of the bullets and the wads there will be your priority in firearm cases, but very less medical officers are doing at their centers. And if someone is doing to add to their knowledge, I would request to trace the missiles, either it is a bullet or pellets from the body, preserve it for forensic ballistic examination, so that which will be further confirmatory during the trial. These are the pellets removed. The wad, you can see this is wad, and these are the pellets removed from the body. And if the X-ray facility is available, one has to take the X-ray so that you can locate where these missiles are actually lying. Bullet also. as you know that taking it in a tool plane is always helpful so that you can trace and collect. Handling it with your without any forceps instrument, it is suggested that you should handle it with your hands to avoid any scratches on the surface of that bullet. So some artifacts will also put you in trouble. Likewise, the central line insertion or contusions with these situations, or the incisions given during the treatment of burn cases to avoid the fasciitis. So you may take it as an injury, but these are therapeutic marks or the incisions given. So artifacts are the features which may sometimes misguide or put you in trouble in noting down what actually it is. So you all should be aware that yes, during transportation also sometimes the dead body will sustain some injuries. You have to think of whether it is an antemortem or artifact, and accordingly you have to mention it in your report. So sometimes the decomposed bodies also will be coming, but opening every body cavity will lead to the any further conclusion. See, the brain is always liquefied, almost liquefied in decomposition, and you can see whether the base of the skull is fractured or not. If any reddish color is also available in such a liquefied brain, which will suggest that yes, hemorrhage was there or hematoma was there earlier. So not to leave anything unturned, unattended during the autopsy, because which particular part will give you any better clue, you never know. So that we can see that the solutions available for such things is practice, dedication, and attend the medical legal autopsy without any hesitation. Note down whatever things you see and then think of, not to make any hurry. Get you the help of your senior medical officer of the center or nearby center, or your forensic medicine friends, so that they can at least help you in concluding what observation you made during any case you attended. So it is suggested that the postmortem skilled attendant is necessary so that they can have the proper training there, and they can do the better postmortem works. And for that purpose, they are in need of training as a regular basis. I will put this request to the Deshmukh sir that this kind of trainings are really helpful for them, preferably on ground training, so that the medical officers, those are equipped with the mortuaries there, they should be sent to the nearby civil hospital or medical colleges so that they can get the proper training. And help of forensic experts should always be taken whenever they are in need, and should be done preferably by the forensic experts people, but medical officers also are trained. Medico-legal cases and medico-legal autopsies is the work of all registered medical practitioners. No one can just say after getting registration, they are supposed to do these compulsory duties. But for that purpose and for better outcome, it is our responsibility to get trained very well, ask for the training, get the proper help from your seniors. And every medical officer, that's why, should undergo the training. And it is always better to have at least minimal training, some sort of exposures, which will help them. Sometimes nowadays the in-service candidates are opting for forensic medicine, so their Posts are specially kept. In addition to the routine work, the medico-legal cases, they can perform the complicated medico-legal autopsies also at their centers. So this will help. And some of our participants also suggested that they will be suggesting to have some post at the primary health centers. And I'm not taking it on my own. These are the suggestions given by our participant in that survey. Every medical officer should be trained, and what sir has discussed related with 375 and 376 related cases, how it should be meticulously done so that the conviction will be met and no guilty person will be living free. So the proper medical legal services has to be looked after as the priority if we want to have the better harmony in the community. It is also said that 10 to 20% of the medical legal autopsies at various centers are natural deaths, and wherein the cases they are just labeled as medical legal because they are broad dead and no other history or reasons are there. And that's why our medical legal section will be sending it for medical legal autopsies. The medical officers think that these are unnecessary things to be avoided, but we never know which case will get complicated and will turn to be the another meticulous or another complicated case. So in that, it is always better to have the detailed things, not to miss the minor injuries. Sometimes the folds over neck will look like as if it is an injury. If the ligature material is very soft, like sari, dupatta, it will not showing the furrows or grooves there. But if it is neglected or not been seen, overlooked, then the possibility of missing these things, and we sometimes may label it as not necessary postmortem. It's like this. So not merely depending on whatever is given in the inquest, but has to be meticulously attended through the various observations. So these are the further suggestions. On-place training of 7 days with various complicated case is to be required. Training, proper work, proper room, instruments, facilities. Newly appointed medical officers always are to be given exposure because they are most of the time unaware. It is the responsibility of senior medical officer to teach them accordingly. And FMT department is the suggestion at Taluka place by some of the medical officer. They also said that the bags, the long sleeve gloves, and even the bottles are sometimes not available, should be made available, are some of the suggestions, and which really are nothing but the solutions on what difficulties our friends are facing to. So getting trained is one of the better solution. Good infrastructure with all the facilities, not to see medical legal autopsy or the postmortem as a neglected part, but should be as one of the crime restricting scenario or the way through which we can stop all those things. So further queries are raised by of our friends that how many autopsies are to be performed at most in 24 hours. It's not like that. because some of our friends in mass disasters or the calamities, but they are carrying the autopsies up to 20 autopsies. But yes, if it is only restricted human resources, it can be planned well accordingly, according to the situations there, avoiding the harder law and order situations there. And in how much time it should be completed, it's not like that. It's not fixed. A complicated case may take many more time than the routine work. But if you perfectly do the things, opening all the 3 cavities, on an average, it will take 1 to 1.5 an hour for one autopsy. And in a complicated, even it may take 4 hours. Custodial deaths, it will take 5 hours sometimes. Does it necessary to have an attendant or assistant doctor while performing the autopsy? Assisting the case, assisting doctor is necessary for noting down. You can observe, you can dissect the body. It's not that the assisting attendant only should do. It's your choice. And again, the notings are to be recorded proper, taking the photographs if you need, but seeing all the organs in complicated case, there's observations it needs. Whether a single doctor can be a competent to do the autopsy in absence of assistant? Yes, certainly. Assistant means what? Assistant doctor or a helping attendant. So doctor has to note down the things. He himself or alone can't do it. It's a team rather, what I suggest. So with this, I rest my presentation on this point. Hope I touched the points of the difficulty, and solutions are nothing but our own initiations or readiness to overcome the problems. We have to get trained, see as medico-legal postmortem work as an important one, so that it is the way to give the justice to someone. So prioritize your medico-legal work and medico-legal postmortem work. So with this, I complete my presentation, sir.
थँक्यू डॉक्टर पवार सर. तुमचं एन्थुझियाझम, तुमचं डेडिकेशन आणि पॉझिटिव्ह अप्रोच मला प्रचंड आवडलेला आहे.
आणि आम्हाला सुद्धा
सगळ्या लोकांसमोर
आम्हाला सुद्धा तुमचा आवडला सर. तुम्ही म्हणजे या मुद्द्यामध्ये हात घातला आणि हे तुम्ही विषय सर सगळ्यांसमोर आणायचा प्रयत्न केला. मला खरं तर तुमचं अभिनंदन करायचं, तुमच्या टीमचं करायचं आहे सर. कारण हा विषय
सांगतो सर मी. 2 गोष्टी सांगतो. एक तर माझ्याच एका फॉरेन्सिक एक्सपर्ट मित्रांनी मला व्हॉट्सअप मेसेज केला आणि सांगितलं की आजच्या वेबिनारला मॅक्झिमम अटेंडन्स आहे. ही एक पहिली गोष्ट. आणि दुसरी गोष्ट म्हणजे आता आधीचे स्पीकर आहेत, आता येणारे स्पीकर आहेत, तुम्हाला पर्टिक्युलरली डॉक्टर पवार, मी तुम्हाला सोडणार नाहीये. मला तुमच्या तिघांकडून एक 2 दिवसाच्या वर्कशॉपचा पूर्णपणे मॉड्यूल पाहिजे सर.
हो सर.
From the SHRC, we are going to conduct a workshop for 2 days. Government of Maharashtra तर्फे. तर त्यासाठी you will be invited, no doubt. पण त्याचा एक मॉड्यूल आपण करून द्या जनरली.
नाही हा सर
बोलतो
बरोबर. हा विषय नेहमी सर असा निग्लेक्ट केला गेलेला आहे. निग्लेक्ट इन द सेन्स सी द सिच्युएशन ऑफ मॉर्च्युरीज आर समवेअर निग्लेक्टेडली प्लेस्ड. दे आर नॉट मेंटेन प्रॉपरली. तुम्ही हे वेबिनारच्या माध्यमातून जेव्हा इनिशिएशन घेतलं तर आपण ते सुधारायच्या दृष्टीने सुद्धा स्टेप्स घेऊ शकतो, जेणेकरून हे मेडिको लिगल सर्व्हिसेस चांगले होतील सर.
म्हणजे आपल्याला मेजरेबल चेंजेस काय करता येतील या सिस्टीम मध्ये. मेजरेबल चेंजेस म्हणतो एकदम हिरोईक तुम्ही सगळे सांगितले पॉसिबल नाहीये. मेजरेबल काय करता येईल आपण ऍट द एंड ऑफ दॅट वर्कशॉप, 2 डे वर्कशॉप आपण गव्हर्नमेंट ऑफ महाराष्ट्राला सादर करू आपण ते.
एक्झॅक्टली. येस सर.
माझे स्वतःचे 2 छोटे प्रश्न होते. मे बी होतो. एक तर तुम्ही म्हणता की अवॉइड द स्पॉट पीएम. असा काही रूल आहे का की स्पॉट पीएम आपण अवॉइड करू शकतो?
नाही, फॉर बेटर एक्झामिनेशन because at the spot you will have the limited resources, sir. The space, the availability, then the instruments, our attenders noting. If it is really unavoidable, one has to do, and our medical officers and even medical uh, faculties are doing these things in inevitable situations. So if it is the situation like where you can't avoid, one has to do. But if it is possible to take the body to the mortuary, it's always better.
Yes.
Because you will, yes, sir.
And my second question about the night hours PM. After sunset.
Latest, yes, sir, latest guidelines are there that try to avoid the night postmortems in cases of complicated cases, usually the homicidal cases, dowry cases. And why this is? Because you are supposed to miss the major findings, and it is the home ministry's guidelines that night PMs are to be avoided, and where the facility is available, they can do the postmortems in other cases wherein the relatives will not suffer because they have to take the body to the far places from the tertiary care centers, and those are not complicated cases. In that cases, they can do the night PM, sir.
Sir, again, there is a gray area. Try to
Yeah.
avoid it, there is a gray area.
No, avoid in the sense complicated case has to be done in the daylight, in the mornings, where, yes, sir.
Okay.
Yeah.
Sir, thank you very much. आता काही क्वेश्चन असतात आपण सर पाहूया. क्वेश्चनचे
नंतर
आपण
घेतलेले
जरा
आहेत,
उत्तर
सर.
द्या.
नाही, मला असं वाटतं सर, डेरे सरांना आपण बोलूया, त्यांचं प्रेझेंटेशन
ओके, चालेल. चालेल. आणि
Because
मग आपण कॉमनली करूया.
yes, yes.
Yes. Okay, okay.
Because
No
question
problem.
hours, yes, sir. I feel
Yes.
you can proceed
Yes.
according to your schedule, sir.
Yes, sir. Yes.
Please, sir.
Thank you very much, sir.
Thank you.
Now our next speaker is Dr. Rajesh Dhere. Sir, Dhere sir आहात ना? जॉईन झालात ना? तुमचा व्हिडिओ दिसत नाहीये. ऑडिओ चालू झालाय.
हा, जॉईन मी केव्हापासून. मी पवार सरांचं पूर्ण ऐकलं.
हो हो, पण व्हिडिओ चालू करा ना. आम्हाला तुम्हाला पाहिजे इच्छा आहे.
रिलोड करू.
नाही सर, रिलोड नका करू. व्हिडिओ वरती सर
तुमचा दोन स्क्रीन दिसतोय सर. एक मला वाटतं मोबाईल दिसतोय आणि एक लॅपटॉप दिसतोय कदाचित.
मोबाईल.
हा, दोन ठिकाणी तुमचं स्क्रीनवर दोन ठिकाणी दिसतंय.
मी लॉग आउट झाले मोबाईलवर.
अच्छा, कारण इथे माझ्या स्क्रीनवर दोन्ही दिसत आहेत.
दोन्ही दिसत आहेत.
हा,
एक मिनिट.
हा.
मी ऍडजस्ट. नाही सर, मोबाईलचा आउट आहे ना मी.
नाही, ठीक आहे, काही हरकत नाही सर. फक्त ऑडिओ तुमचा व्हिडिओ चालू करता येतो का सर, बघा ना.
हो, तेच पाहतो.
म्हणजे पार्टिसिपेंटना जरा छान वाटेल.
स्टार्ट व्हिडिओ.
आपण लावायचं.
सचिनला बोलवा का?
सर वो आईडी वर same as system, select the camera. हाँ
तो कॅमेरा पण आहे ना.
Sir, your screen is visible now, sir.
या,
व्हिडिओ इज नॉट विजिबल बट आता आला.
आला सर.
नाही विजिबल टू यू.
Yeah, you are visible to us. I think my video is not on. Sir, ते PPT तुमच्या कोऑर्डिनेटरची PPT शेअर केली आहे.
ओके,
त्यांना थोडं टाकायला लावा ना प्लीज.
काय हरकत नाही. जर एक फॉर्मली मी आपल्याला इंट्रोडक्शन करून देतो सगळ्या आपल्या पार्टिसिपंटसाठी.
हो, तोपर्यंत चालेल.
डॉक्टर राजेश डेरे सर हे MD FMT आहेत. PG, DH and ACM, and he is also a lawyer. He is LLB. आणि सरांच्या सांगायचं तर त्यांनी यादी मला जी पाठवली आहे, सरांच्या नावाने एवढे सन्मान मिळाले आहेत, त्यांना एवढे पुरस्कार मिळाले आहेत की मला वाटतं पुढचे 5-10 मिनिटं ते वाचण्यात जातील. तेव्हा मी थोडे कटशॉट पण 2-3 वाचतो सर, विथ युअर परमिशन. He has awarded the Mahatma Gandhi Samman for the contribution of COVID-19 in pandemic by NRI, Welfare Society of India. Then felicitated by the erstwhile Chief Minister of Maharashtra, Shri Uddhav Thackeray, for the valuable contribution of pandemic in BKC Vaccination Center. He got the Gau Bharat Special Award, Government of Maharashtra.
मला स्क्रीनवर दिसत नाही.
He has successfully reached the India's largest and world's second jumbo COVID facility of nearly 2,500 beds. He has given the expert opinion in various medical legal cases referred by CID, CBI and the crime branch. He is appointed as a medical expert by Government of Maharashtra in terror strike.
काय झालं?
He is a Bharat Ratna APJ Abdul Kalam Award 2021 and also the recipient of Atmanirbhar Award Vision of New India in the 62nd National Summit
जल्दी
at
आने बोलो.
Mumbai. So now I request Dr. Rajesh Dhere sir, even though his video is a problematic one, we have uploaded the PPT, so you can start, sir.
PPT I have shared. I
Share.
think
Yeah,
Dr.
I shared.
Rajesh-
Can you see the PPT?
No, I can't see PPT.
Just 1 minute.
तर तुम्ही रिमूव्ह केले विदाउट व्हिडिओ जॉईन केलेले पीपीटी विजिबल होतात दुसऱ्यांना.
त्यांनी केली म्हणते.
PPT में सब दिसत
तर
नाही.
तुम्ही डिस्कनेक्ट करून परत कनेक्ट करा.
आम्हाला दिसत नाहीये PPT.
तर तुम्ही डिस्कनेक्ट करा आणि परत जॉईन करा सर.
My voice is audible to you clearly?
सर तुमचा व्हॉइस ऑडिबल आहे. बहुतेक प्रॉब्लेम असा आहे की ते व्हिडिओचा आहे, तर तुम्ही एकदा डिस्कनेक्ट करून परत रिजॉईन व्हा.
परत हा
आपण
1-2
एक मिनिट वेळ
मिनिट.
घेऊया.
हा 1 minute we'll do that.
Definitely, sir. Audience, please bear with us. सर तुमचा व्हिडिओ दिसतोय फक्त स्थिर होत नाही तो व्हिडिओ फिरतोय जरा. सर कॅन यू हिअर मी? मुंबईच्या माणूस इकडे काही प्रॉब्लेम असेल तेच प्रॉब्लेम आहे. पहिल्या वेबिनारला नागपूरच्या माणसाने प्रॉब्लेम केला. छोटे मोठे माणसाने घेतले जशी जॉईन सर आवाज येत नाहीये.
Hello. Hello.
ऑडिओ काय आहे?
Am I audible now?
येस सर.
नाही सर इथे इश्यू झालाय मेडिकल कॉलेज नाशिकला कनेक्टिव्हिटीचा.
आपला ऑडिओ आपला व्हिडिओ का बंद झाला? नाही चालू होत नाही. सर स्क्रीन शेअर करू का तुम्ही करताय?
नाही तुम्ही करा सर.
बरं ठीक आहे.
करा.
या सर मी. सर दिसतोय स्क्रीन तुम्हाला आता?
हा
स्क्रीन दिसतोय का तुम्हाला? तुमची पीपीटी दिसते का?
दिसायला लागला. ते पण कनेक्ट दिसायला लागला सर, दिसायला लागला. थँक्यू.
येस येस.
हॅलो.
करायचे.
प्लीज. Hello. Hello. So we'll take on mobile. No problem. You can start on mobile. And thank you very much, HRSC Pune, Deshmukh sir, and I would predominantly thank. Am I audible, sir, to everyone?
Yes.
Yeah. I would predominantly thank our PG student and now medical superintendent Dr. Abhijit Osmani for coordinating for these topics. Now let us we'll come to the point. The topic which I would be discussing with all the medical officers through SRHC is testimony in the court of law. Now, why it is important to have a good testimony in the court of law is a very simple aspect. What we do is medical officers do postmortem very meticulously. They make note meticulously, but somewhere it is well said, unless and until you put your evidence properly on record to the honorable courts, conviction is very difficult to get in such circumstances. And that is one of the reasons that conviction rate in our country is near to 6 to 7%, which is, I would say, one of the lowest in the developing nation or the developed nation. Now just have this basic acts. What is all this evidence are covered under Indian Evidence Act of 1872. Next slide, please. Just we will enumerate what are the types of evidences. First one is based on the oral evidences. Medical officers should not confuse best manje best evidence. It is not best means best evidence. This oral evidence, we all know what we depose in the court of law, and best means the real evidence which we put forth on record in front of the courts, maybe the session courts or the taluka courts. Circumstantial evidence is what circumstances leads to that event. That once we discuss cross and re-examination, I will put up my examples to substantiate all these. Third one is direct evidence. Direct evidence means it is so simple. XYZ person has witnessed that offense. Take an example, some assault has taken place in say King Circle in Mumbai, and XYZ has witnessed that assault. So whenever this witness, common witness, goes in the court of law and deposes in front of the court, his evidence would be labeled or considered as an direct evidence. And direct evidence in the court of law and as per the various provisions of the law has more weightage than any other type of evidence what we are discussing now. Hearsay is just a third party evidence, means आपण एक सांगतो ना की एकाने केलं, दुसऱ्याने ऐकलं, दुसऱ्याने तिसऱ्याला सांगितलं. It is just as simple. A has committed an offense, B has seen that offense, C has the knowledge that B has seen that offense, that the C's evidence court what we are deposing will be labeled as an hearsay evidence. As of now, hearsay evidence in the court of law has no substantial value for conviction. But yes, if this hearsay evidence is corroborated by the corroborative evidence, that is our next one. If it is corroborated by the corroborative evidence, along with the corroborative evidence, if the circumstantial evidence also is corroborated properly, then yes, this hearsay evidence can be taken on record for conviction purpose. Next is corroborative evidence, we have discussed. Next one is the documentary evidences. Now, we all know in the medical field and in the consumer era, documentary evidence is one of the best defense for any doctor in the court of law. The simple reason is that nowadays, most of the eyewitness turn hostile in the court of law for various means and measures. Now, if you go down the lane for last 5 years, in the court of law, most of the convictions are either on the corroborative evidence or maybe on circumstantial evidence is corroborated properly. But it is rare to see now direct evidence and the eyewitness in the court of law. So for all the medical officers, now I will label all the medical officers as registered medical practitioner. That is the correct legal word for all the medical practitioners. So all the registered medical practitioners should keep this documentary evidence intact, and for years together, I would say there is one Supreme Court order which clearly states that if you are doing any medical legal case, your document should be preserved lifelong. Leave aside what hospital manual says 5 years, 10 years, 2 years, 5 years. There are various state amendments in say Madhya Pradesh, Rajasthan. They have their own rules and regulations. But as a matter of safety to all the registered medical practitioners, documentary evidence of any medical legal case, please preserve it in hard copy format or soft copy format lifelong. Next one would be primary and the secondary evidences. Last one is real evidence. You know, this is something new added. Now, we all will feel, what is this real evidences? Nowadays, in last few years, 4 to 5 years, we all know because of media savvy gadgets are available in the system. Nowadays, everyone coming to us will keep their mobile recording on. They will photo click your photos when you discuss with your patients or relative of the patients while conducting PM or after conducting PM or doing medical legal duties. Now this nowadays available hard disk, photocopy, digital photography and the digital videography which is placed on record in front of the court of law is called as a real evidence. Now this real evidence itself is examined by the court only. There is no need of any cross in this. If the court examines that real evidence and if it is verified beyond doubt, then it can be taken on record. Next slide, please. Now we'll go one by one. Which are the sections related with? Which are the sections related with the corroborative evidence? Section 156 and section 157 says that whenever a witness whom it is intended to corroborate give evidence to any relevant fact, he may be questioned as to the circumstances which he has observed or the place which such relevant fact has occurred. If the court is of the opinion that such circumstances, if proved, would corroborate the testimony of the witness. See, simple meaning of the corroborative evidence is that whatever evidence is given by the registered medical practitioners in the court of law. To take example of our postmortem report. Postmortem report, some feels that it is a direct evidence. In the protocol of the evidence, Indian Evidence Act, all the medical legal documents, maybe postmortem reports, maybe sick leave certificates, maybe MCCD certificates, are corroborative evidence only. So 156 and 157 says, if such corroborative evidences are corroborated and proved in the court of law, when the evidence is proved in the court of law, when this evidence is cross-examined by defense counsel, and after the cross-examination, if it is justified by the court, yes, this corroborative evidence is the matter to the fact which has been presented by the registered medical practitioner, then this corroborative evidence is taken on record for argument purpose, which may lead to conviction of that accused. Now, next would be the documentary evidences. Now, we all know what are the documentary evidences. Now, for this documentary evidence, if you could read this properly, what court will verify? Court will, number one, verify. They have three questions in their mind. Number one, is the document genuine? See, we all medical officer, when we go in the court of law, we stand in the court box with our PM notes or say injury reports or any of such report. First question put up by the examination in chief, they will always give a copy, original copy of the charge sheet, which is submitted to the session courts, and they will show us, yes, doctor, his barabar copy hai ka tumi, tumcha second copy barabar check kara. See, this is where first question, if you provide your documentary evidence in the court of law, will be, is this document genuine? And to check the genuineness of this document, court will give their original document to you in the court box, and they will ask you in the courtroom, yes, doctor, whatever record you have prepared and submitted to the police, is this the same document? So this is the question one, that whether it is genuine. Second would be, what are it contains? We all know, all the medical officers, once we conclude examination in chief, please recollect, आपण सर्वांनी recollect करा, जेव्हा आपल्याला prosecution counsel, म्हणजे आपला PP ज्याला आपण म्हणतो government counsel, he concludes towards examination in chief. At the end, he will always take a positive suggestion from us. Doctor, whether this document is written by you, we will say, Koni Leela, who has written this document, konaच्या handwriting मध्ये, whose handwriting is this, whose signature is this, whose seal and label is this. Then they will say, we always say the contents are true to the best of my knowledge. See, this is where the second part is verified by the court, whether the contents written in your document is true to the best of your knowledge. Now, third would be, are the statements made in the document true? Now, what do you mean by statements made in the document? Now, along with PM report, we mostly give some opinions. See, after giving a cause of death or provisional cause of death, investigating officer tends to give you a query letter. Ek patra deta ki they will just ask you query related to that case, and you are supposed to make an opinion based on your findings of that PM report or the medical legal examination sheet, and that document would be a separate document which would be given to the investigating agency to be produced in the court of law. So they will always say, yes, this extra document which you have provided to the investigating officer, and the investigating officer has provided to the court, whether the statements or opinion given by you with your signature to the investigating officer is true or false. So whenever a documentary evidence is given by any registered medical practitioner in the court of law, these three things are verified by the court of law. Is the document genuine? What are its contents? And the statements provided in the documents are true to the best of your knowledge. Now, again, these documents can be divided into two parts. Number one would be the public document, and second would be the private document. Now, medical officers may feel that we are working in the government setup. What is our relation with the private document? Now, these private documents are submitted if a patient of MLC is admitted in some private hospital. And as of now, we have a wrong notion in our minds that only government hospital are supposed to 100% do the medical legal cases. There is no such law. There are many medical legal cases I would name you, which were admitted in corporate hospital or private hospitals, and they have provided injury report, which was submitted to the court of law. And after cross-examination of that doctor, that submitted private document was taken on record for argument purpose in the court of law. So this government documentary evidence are of two types. Next slide, please. Next slide, please. Now see this, Section 45 of Indian Evidence Act. This Section 45 of Indian Evidence Act is important for we all because this act defines what is an expert. I will read out, then we will justify. What this section says, when the court has to form an opinion upon a point of foreign law or of science or of art, or as to the identity of handwriting or fingerprint impression, the opinion upon that point of person specially skilled in that foreign law, science or art, or in question as to identify the handwriting or finger impression are relevant fact. Such persons are called as an expert. The opinion of the expert on the question whether the two documents are written by the same person or by different person are relevant. Now see what importance the expert has been given by the Indian Evidence Act. Always keep this in mind. The judge or the judiciary who is presiding over that court is not expert in our science. Always please keep this in mind. He is not expert in our science. So we have an upper hand once we discuss our opinion, once we substantiate our fact in medical legal document in the court of law. So this Section 45 defines an expert that any person having a knowledge, I would say certified knowledge in that science can provide an opinion. Now, many a time we always say that take conducting PM examination, whether MD forensic is only the expert as per Section 45 of Indian Evidence Act for this purpose, or MBBS doctors also do medical legal PM or medical legal documentation, whether they are expert as per this section. Please read this section carefully. It doesn't say whether you need to be a specialized or super specialized doctors to be skilled in that science. So any graduate in medical science, which is defined under Indian Medical Council Act, now it is National Medical Council Act of 1956, can act as an expert in the court of law. Only the question defines here is that whether any case which has a technical requirement, whether that should be done by a medical officer at PSC level or civil hospital level where there are no MD forensic available. Now, why we are discussing this case, please take into mind that you take an best example of Sheena Bora bone examination cases. Just take an example that bone's skeleton was examined at district level, and that at that point of time, at that civil hospital, there were no forensic experts or MD forensic people available. And we all know, we all have done MBBS, and till MBBS, we hardly do any medical legal autopsies with our own experience or with our own expertise. So in such cases, I would suggest that if expertise in forensic medicine is not available at taluka level or district level, and if that case requires higher technical knowledge in that subject, say forensic medicine, please avoid doing PM at that centers. You please request your investigating officer that you go nearby medical colleges who is empowered to do the medical legal postmortem, and let the professors and the head of the department, senior faculty of that government medical college do such technical cases. But in no way I am saying that MBBS doctor is not expert in doing such cases. So next section would be section 46. It relates to facts bearing upon opinion of expert fact. Next slide, please. Next slide, please. Now we will discuss with examination of the witness. Now section 135, order of production and examination of witness. The order in which witnesses are produced and examined shall be regulated by the law and practiced for the time being related to civil and criminal procedure respectively, and in absence of any law by the discretion of the court. It's simple, you know, it is the duty of the court to order for the production and examination of witness. Now, this starts with receiving a summons by the concerned medical officer or registered medical practitioner. See, when a court issues a summons to us, we are bound to obey this under section 135, that court has a right to order for production and examination of witness. Now, section 136 states that judge to decide as to admissibility of evidence. I will just read out that bold lines which is relevant in this section. If the fact proposed to be provided is one of which evidence is admissible only upon proof of some other fact, such last mentioned fact must be proved before evidence is given of the fact first mentioned, unless the party undertakes to give proof of the fact and the court is satisfied with such undertakings. Now, I will give you best example what we face related to section 136. 136 states that judge has a right to decide whatever you give evidence in the court of law based on your document, your expertise regarding the admissibility of this evidence. Now, I also faced such issues. We all doctors face that sometimes, you know, a question is put forth by the defense counsel and we give some reply of say 3 or 4 lines. And maybe after, hearing to your opinion to that question, the judge may only take your 2 lines. And I feel as a doctor, अरे मी तर चार गोष्टी सांगितल्या होत्या and only two are taken on evidence on record by the honorable court. See, there this section is related that the judges are empowered to decide what is the admissibility of the evidence. That means we should not feel as a registered medical practitioner or expert witness that whatever I describe to the court, it should be taken in letter and spirit. म्हणजे आहे तसं घेणं हे कोर्टाला मॅन्डेटरी नाहीये. Court has the presiding powers under section 136 to decide की जर तुम्ही हे सांगितलेले आहे त्याच्यातली admissibility to that case किती आहे, he has right to decide. Now second question आपल्याला मनात येतो, I may think that I am right, I think that this should be taken on record, but even after my request to the honorable court, this is not taken on record and evidence. Now what is the option available with you? Please note it down, all medical officer, carefully. See, this is very important. I have done n number of times. Whenever I feel that whatever opinion I have provided it to that question is not completely taken as it is on the record by the honorable court, as they have the discretionary power, but as an expert witness and the prosecution witness, I do have also authority through the public prosecutor can put an application after your evidence is over through the PP. Always keep in mind, you should not apply directly to the honorable court. Send it to your PP and you request in your application that, sir, this much reply was, I have forwarded, given it to that question raised by the defense counsel. But it is noted by me, out of this, only 50% of the content are being recorded on evidence, which I requested to the Honorable Court in the box itself. Still, it was not taken. I kindly request you that the remaining content of my reply is also beneficial to this case and which should be taken on record on evidence. Now, what judge will do if this is forwarded by PP to the Honorable Court? He will place this application on record, and this application with your remaining content will be argued by your PP. म्हणजे जो prosecution witness governmentच्या बाजूने, he will argue based on your application in which the remaining content is that, so that if that opinion provided by you is beneficial for the victim, it will be taken during argument. So this is the relevance of 136. So do not be adamant and तिथे भांडत बसू नका कोर्टामध्ये की मी सांगितलेलंच घेतलं पाहिजे. The judge has every right to take a part of your evidence. Next slide, please. Next slide, please. Next slide, please. Now please check this relevant section. Section 141, leading question. सर्वात जर भीती आपल्याला आहे as a prosecution witness in the court of law, this is what we face, leading questions. Leading questions is those questions which suggest itself an answer. So leading question is what we should reply with due precautions and due patience. Now again, these leading questions are only allowed to defense counsel during your cross-examination. This is not allowed to your prosecution counsel during examination in chief. Section 142, when they must not be asked. So 142 gives the law that when this leading question should not be asked. Simple answer is under 142 section, leading questions are not allowed in examination chief or re-examination. Now section 143, when they must be asked. Yes, leading question may be asked in cross-examination only. Now take it an example. You know, in most of your forensic books, this is not mentioned. Section 143 only mentions that leading question may be asked in cross-examination, which is invariably true. But what happens, there is one section and the discretionary power of judiciary has been given. In some cases, if the prosecution counsel, PP, if he feels that the evidence given by you as a prosecution witness in the court of law during examination in chief is contradicting to the case put up by the prosecution counsel in front of the court, then the prosecution counsel has every right to declare yourself as an hostile witness. Please listen to me carefully. Section 143 says that leading questions are only allowed during cross-examination. Very true, it is very correct. But there is a clause and discretionary power to the Honorable Court. If the public prosecutors declares prosecution witness, say doctor, as hostile, then same public prosecutor will call you in the court box and cross-examine you. Even though you are a prosecution witness, then the prosecution counsel or the lawyer has every right to put a leading question to you. Please keep this in mind, that in that, if you are declared hostile and if the prosecution counsel calls you in the court box, she or he has every right to put up a leading question to get the facts of the case. Next section is 154. Question by party of his witness. See, this is very simple. The court may, in its discretion, permit the person who calls a witness to put up any question to him which might be put in cross-examination by adverse parties or hostile witness. See, sometimes, say I am accused in some case, and I may feel my pleader or the defense pleader or the lawyer appointed by me is not putting up my case properly, and I may lose my case and I may face for some conviction. Now, you can request to the court as an accused or the witness also that please allow me for examination also. And court has the discretionary power that he can allow you for cross-examination or examination also. So that is section 154. Now 159, again one of the important section is refreshing your memory. See, this we rarely do. This section provides you that you should refresh memory whenever you go in the court of law, and you are allowed to carry your document with yourself when you are going for cross or examination in chief. No one has right to say that you should not go through your PM report, you should not go through your statements provided to the police. Now section 165, judge power to put question or order production. Now we have seen that once our examination is completed, say after re-examination, if court feels or judge feels that some matter is yet to be produced or taken in front of court, so court can question you also. Please do not feel why judge is asking me whether I am wrong, I have done such a good thing, I have done my PM correctly. So judge has a right to question you. Please listen to that questions patiently and give a justified and reasonable reply to judiciary's question. Next slide, please. Next slide, please. Now see what we should take care before going to the court. A registered medical practitioner, we should be punctual and our demeanor should be good. Punctual means what? Once you receive your summons, please respect and obey that summons. Many a time, I have seen that the medical officers are issued warrants, bailable warrants, non-bailable warrants, if they are not coming to court as per the summons received by them. Please, as a registered medical practitioners, please obey the summons. If you are busy on that day, please inform that court through your PP or your police constable of that police regarding your unavailability and request for next date. Be punctual and have your good demeanor. Second is be fair and frank. Now, whenever you depose in the court of law, be fair and frank. See, I have most of the medical officers or doctors depose in the court of law are adamant. See, I will give you a best example. During cross-examination, if the counsel are good, if that defense counsel are good in forensic knowledge or medical knowledge, they will show you various books. See Dr. Modi, see Dr. Reddy, it has been written that if they say semi-digested contents are present in the stomach, then the time of death from last meal is 3 to 5 hours. And maybe that medical officer has not mentioned the semi-digested food properly in that content column of his PM report. What he will say? No, I don't know. I do not agree with Reddy. I do not agree with Modi. So please, as a registered medical practitioner, be fair and frank. Be fair to your opinion. Suka saglancha hotat. We may miss out some finding in our PM report, and don't feel that if I agree, yes sir, I may agree in front of court, yes, I failed to write this content of stomach in my PM report. Yani kai tumhala shiksha hot nahi hai, you are not a culprit for in front of the court. But please be fair and frank. It will give you a good impression in the court of law, which will help you in the conviction of that court. Third is clarity of the subject matter. Again, this is very, very important. Whatever you are deposing in the court of law, take example of PM report of say I will give an example of hanging case, asphyxial death case. Keep clarity on your opinion when you are deposing in the court of law. take an example of a question. If a question is put forth to you as a medical officer by the defense counsel in cross-examination, stating that, doctor, I put up to you, or they will always say in this manner, is it true to say that hanging opinion provided by you is always suicidal in nature? Now what happens in this, sometimes in the same case, rather than suicide, police may file a FIR of 302, or they may file an FIR under section, say, IPC 300. It is culpable homicide not amounting to murder. In this case, what medical officer say, he may feel that this is a case of murder or application of 302. So he will disagree with the defense counsel. No, I cannot, or I will reply, मी तुम्हाला निश्चित नाही सांगू शकत. Then our reply would be, I cannot recollect it properly. Now I am not in a position to say whether this hanging is a suicide or not. Please do not do such gimmicks. This spoils your impression in the court of law. This will question your credibility in court of law. If in the forensic knowledge or in the textbooks, if we know that the hanging procedure is mostly suicidal, and if a question related to that has been asked, please reply it based on your scientific knowledge only. You just reply, yes, as per scientific knowledge to me, suicide, hanging is mostly suicide in these cases. So have your clarity on the subject matter. Next would be speak clearly and coolly. In courts, mostly during cross-examination, it is the duty of the defense counsel to make you some, they will shout at you, they will put up such denerving questions to you, which you feel, अरे मी डॉक्टर असताना मला असे का प्रश्न विचारले जाते? अरे, they may say, doctor, तुम्ही खोटं बोलताय, your evidence is not true. And again we lose our temper and say, अरे advocate, how you are talking in this manner and what you are doing. See, this should be avoided. You should be cool in the court of law. When you are in the courtroom, keep your patience at your maximum. It is the right of the defense counsel in cross-examination. He has right to put up a question with a content which may irritate you. Sometimes, defense counsel do ask us, Doctor Sahib, तुम्ही खरंच doctor आहात का? Immediately, if we lose cool, we talk with them. We'll say, काय lawyer काय बोलताय? माझ्या का डिग्र्या खोट्या आहेत का? See, this is not the way of replying in the court of law in cross-examination. Keep yourself cool. Let him put up you any type of question. You analyze that question. For this question, I would say, yes, doctor, my degree is true. My registration is proper. I have done my MBBS or whatever degree I have in this year from this medical college, and I am practicing, say, in government setup for, say, last 10 years, 12 years, 15 years. So please do not lose your cool in cross-examination. Then be clear and cool, but not coldy. What do you mean by coldy? Court should not feel that your behavior in the courtroom is undesirable. Some doctors, behave improperly when they are standing in the court box. हात कमरेवर ठेवणे. When the prosecutor, the defense counsel is asking a question to you, you will just see, look here and there in the court, will laugh at some questions. So not be a coldly. Coldly means a undesirable behavior in the court of law. Speak clearly and coolly, but not coldly. Next would be give direct answer whenever possible. See, this we should take care. All the medical officer, I have given n number of second opinion for many medical officers, civil hospital doctors who have conducted postmortems, provided opinions. I have gone in the court and listened to all such medical officers, doctors, while providing direct answers. We rarely give direct answers. Whenever a question is put forth to you, I will give an example now. Take a weapon during examination in chief. A weapon article which has been recovered by the investigating officer is shown to me by the prosecution witness, and a question is put forth to me, doctor, तुम्ही जे पीएम ग्रुप मध्ये जखमा लिहिल्यात किंवा इंजुरी रिपोर्ट मध्ये लिहिल्यात ह्या वेपननी होऊ शकतात की नाही. Now what is my role as an expert? My role is to give a direct answer. I should not say होऊ पण शकतात नाही पण होऊ शकतात. This is what is not expected from a expert witness by the court. You are expected to give direct answer. If you feel, say example in your PM report, there is a stab injury mentioned in column number 70 and a pinpointed object is shown to you, knife is shown to you. I know that a knife can cause a stab injury. So my reply should be direct. I would say yes, that the weapon which has been shown to me is a sharp cutting pointed weapon. And this sharp cutting pointed weapon, when introduced inside the body, can cause stab injury, which I have mentioned in my PM report. Be direct to your reply. When you give your indirect answers, when you give your ambiguous reply, please keep in mind it benefits your defense counsel only. Law is very clear that whatever benefit of doubt will always go to the accused. याचाच अर्थ असा आहे, if you give such indirect answers, you are supporting the accused in the court of law. Please keep this in mind. Please change the slide. Please change the slide. So please give direct answer whenever possible. Now, if direct answers are not possible, then you may feel, what should I do? If direct answers are not possible, please give a reply that I should refresh my memory in this question. Give me some time, I will refresh my memory, and then I will reply to this. This should be a proper reply, which would be accepted in the court of law. Next would be answer only the question asked. See, this is very important. The question is put specifically by the defense lawyer. Say, doctor, तुम्ही तुमच्या हाताने लिहिलं तेव्हा तुम्ही हजर होता किंवा नाही. So our question answer should be only to the reply to that question. Do not beat around the bush. We have a habit of explaining everything in the court of law. Every registered medical practitioner. Take an example. Same weapon is shown whether this injury is possible. What I should reply? I will give an answer to that question. Yes, the weapon shown to me causes this type of injury mentioned by me. This is enough. What we people most of the, yes, this weapon was this much size. This is this much pointed. This size wound of entry is this much. Wound of exit is this. No need to give any adjoining replies. Only reply to the question which has been asked to you. Please keep this in mind. Do not give extraordinary reply in the court of law. You will be landing in problem for yourself. Then never lose temper that never lose temper has been discussed. Last one is volunteering a statement. I don't know how many of you know what do you mean by volunteering a statement. As an expert witness in the court box, I have right to volunteer my question. Now take an example that a question has been asked to you. You give a reply to that question, specific reply. But as an expert in that case, I may feel something should be added to my reply. So what I will do, as an expert witness, I have a right to volunteer my statement. So I will request to the court, yes, sir, in this question reply, I need to volunteer my statement. Court will allow you, yes, doctor, you can volunteer your statement. Then you add whatever you want to add in this. So you have a right to volunteer your statement, but before volunteering your statement, please take care that it should be with the permission of the Honorable Court only. Next slide, please. Next slide. See, we will just read out what are the sections. Section 138 deals with all the procedure in the court of law, which we would be seeing. Now, number one would be examination in chief. Next slide. Next slide. Next slide, please. Next slide, please. Now, this is a diagrammatic presentation of examination in chief. You can see prosecution lawyer is there, witness is there, judge is there. Now, the sole purpose of examination in chief is that whatever record on evidence the prosecution lawyer has to put forth to the court will be put in this examination in chief. In short, in examination in chief, whatever opinion we have provided through your PM reports or examination certificate will be taken on record by public prosecutor. That is the simple meaning of examination in chief. In examination in chief, the prosecution lawyer has no right to ask any leading questions. One example of question is hereby noted. Question says that what kind of weapon was involved and what could be the approximate distance. So my reply should be probably it was a rifled firearm and the distance between the range is of tattooing. Next slide. Now this section 137 deals with examination in chief and re-examination. Next slide. Now you see, this is what is important for us. We should take care is cross-examination. This cross-examination is considered as a double-edged weapon. म्हणजे दोन धाली तलवार ज्याला म्हणतो किंवा dagger. This is the stage cross-examination. In this stage, only we, the registered medical practitioners, should take due care, maximum care. When you reply to the defense counsel, you should take. Why? Because in this cross-examination, the defense counsel, as per the Indian Evidence Act, has every right to put you a leading question. He may even, after your few replies, if you give 4 to 5 reply to your questions asked by defense lawyer, and he may irritate you by saying, "Oh, doctor, आतापर्यंत जी उत्तरे दिली, याच्यात असं वाटतंय तुम्ही डॉक्टर की." In this is a leading question. Please take care. Do not lose your temper. Second caution I would say in this, you should take care. Whatever you have said in the examination in chief with related to that question, please stick to that only. If I have said in examination in chief that yes, injury number 1, stab injury over, say, right side of the chest at 5 o'clock position is possible by sharp cutting and pointed weapon. Now, in relation to this, if any leading question is asked by the defense lawyer, which is permitted, please stick to your examination in chief reply only. Do not fumble. Do not get irritated. Do not re-question defense lawyer. See, I have seen I'm giving evidence in the court of law for last 21 years, and I have been cross-examined by one of the best counsels in this country. I've gone for UP for cross-examination, and one of the best counsel in the Mumbai High Courts also have crossed me. But I will tell you, if you do not lose your temper, if you stick to your examination in chief reply, and if you apply your reasonable mind of your forensic or medical knowledge, no defense lawyer can take contradictory statement from you. Please keep this in mind. Be cool, have patience, read your documents properly. Let him ask any question. read your documents first before replying. If defense counsel shows you a textbook, say Reddy, Modi, anything, and he may underline only one statement of that which is beneficial for him, for his theory as a defense, please read above 2 lines also and below 2 lines only. And then you reply, no, whatever you are showing to me is only a part of that. Ideally, this paragraph states XYZ. So this, if you take care in cross-examination, I can assure you, no base-to-base defense counsel can take any benefit of doubt from you. They cannot take any contradictory statement from you. Now, if you do not give any contradictory statement in cross-examination, if you do not give him any benefit of doubt, I will vouch you that conviction would be more in such cases. So please take care during cross-examination. Next slide, please. Is direction of re-examination. Re-examination is usually after cross-examination. And the direction of the re-examination is always with the permission of court, means your public prosecutor. Why re-examination is taken, I will tell you, it's so simple. After going through cross, if your prosecution counsel or PP feels that you have contradicted your own statement during cross-examination, then what she will request court, she has a right under these sections to call you again in the court box for re-examination. The purpose for re-examination in such cases would be that whatever doubts you have created during cross-examination, she will clear that doubts and she will take on record in the court of law for argument purpose. So next slide, this is re-examination. You can see it is just similar to the examination in chief. This is one of the sample question. What would be the usual length of the arm of an ordinary adult male? So the reply should be given as could be 2 to 3 feet. Now the next slide, please. Now this is what is court question we have discussed in our initial slide. Now this court question is not mandatorily to be taken in every case. This court question is the discretionary power of the honorable court. Now after your cross-examination, examination in chief, re-examination, now court also feels after all this procedure, some clarity is to be taken from the doctor or the expert witness. So he can recall you for court questions. Now what he will do, whatever clarity he wants from you as an expert witness, that question he will put forth to you, directly to you, not through public prosecutor. He will directly talk with you, doctor, this is this what you have said in cross, this is this you have said in the examination in chief, and I want to know clarity in this. Please clarify your statements even in examination in chief and cross. Please do not reply to your honorable court that, some of I have heard medical officers in rural areas in session courts or additional they say ki judge sahib already मी उत्तरे दिलेली आहेत ना chief मध्ये, already मी cross मध्ये या गोष्टी बोललेलो आहे, परत का विचारताय तुम्ही मला? See, you have no right to behave in this manner. Please understand, court is supreme. Judge has discretionary power to give you a court question. He has every right to question you again and again, again and again. You are bound to reply to him again and again, again and again. It may take 1 hour, it may take 2 hours, it may take 5 hours also. You are duty bound to reply to your questions raised by your court. So please reply to court question. And good part of your court questions by judge is that usually judge will not ask you any leading questions. So he is authorized to ask you. But he also knows you are a prosecution witness, you are a government doctor, you have done a good job, you have given a good report in this case, but there may be some fallacies or lacunae. He will just clear you, he will not ask you any leading question unless and until, please keep this in mind, Judge will not ask any leading question unless and until you misbehave in the court, unless and until you deny the court judge, unless and until you adamantly reply to the court question. In these three, court can ask you a leading question, and even after hearing to your adamancy and the questions which you are not replying properly, court has right to give you a stricture in these cases. So please be careful in this. Next. Next slide, please. So thank you for this, and sorry, what has happened, this desktop in this medical college, suddenly it went off the internet. So I have to log in through my mobile, and hope so my voice was clear and understandable. Thank you very much for all your patience hearing. Any question, I would be happy to reply with due permission of Sanjay Deshmukh sir.
सर थँक्यू व्हेरी मच. इतकं छान घेतलं सर, आणि तुमचा व्हॉइस जो होता सॉफ्ट व्हॉइस जरी असला तर ऍथॉरिटी आणि ऍथॉरिटिव्ह व्हॉइस होता की काय करायचं आणि काय नाही करायचं. आय लाईक इट व्हेरी मच.
थँक्यू. अनुभव आहे, काय नाही.
नाही पण काय झालं की आमच्या मेडिकलर्सना हा प्रॉब्लेम असतो सर, काय करायच्यापेक्षा काय करू नये हा फार मोठा प्रश्न असतो.
दॅट इज व्हेरी इम्पॉर्टंट.
हा म्हणजे कोर्टात गेल्यानंतर काय करू नये, काय बोलू नये आणि कुठं नाही म्हणून सांगावं, इथेच मेडिकल ऑफिसरचे सगळे फसतात. त्यासाठी अत्यंत चांगला सेशन झाला होता.
थँक्यू.
आपण म्हणजे थँक्यू व्हेरी मच. आपण आता जे काही क्वेश्चन आले ते आपण जरा घेऊयात, आणि त्याच्यानंतर मग एक पोस्ट टेस्ट आपल्याला घ्यायची आहे, आणि पोस्ट टेस्टची लिंक टाकलेली आहे. एकदा पोस्ट टेस्ट झाली की आपण त्याच्यावर आपण चर्चा करूया सर, एक 5 मिनिटं.
चालेल सर.
सो बी बेअर विथ अस ऑल द 3 स्पीकर्स.
थँक्यू सर.
येस सर, क्वेश्चन्स घ्या. हा
Okay, so we can start with how we can say whether accused is
Voice is not clear, ma'am. Voice is not clearly audible.
How we can say whether the accused is potent or impotent?
Yes. Whether we should say or not.
In examination, how we can say? असा प्रश्न आहे सर.
Is it to me or other resource
सर, आता
person?
कसं आहे माहिती का की आता आपण प्रश्न सगळे एकत्र केले आहेत, त्यामुळं ऍप्लिकेबल ज्यांना असेल त्या कोणी जरी उत्तर, कारण ऑल 3 आर एक्सपर्ट्स, जरी सब्जेक्ट जरी वेगळे असले आपले तरी यू कॅन आन्सर सर.
Means the question is whether we can say the accused is potent or impotent in the court of law. See, now if you go through the potency certificate, it is, whenever we opine regarding the accused, see, we give a double negative positive opinion. We do not directly opine that the accused, say Ayub Khan, examined by me, brought by this police station, is potent or impotent. We have no right to say, because whatever examination we are doing in that limited scope of our work doesn't do all the tests. So we always opine that here's the case examined by me. There is nothing to suggest that the person is not capable of performing sexual intercourse. So this is double negative opinion, means in short it is positive only. Okay. But we cannot directly say that he is potent while providing opinion.
Maximize.
Hello.
Yes. काहीतरी एक सुरू करा. कुठे आता प्रश्न, आताचा प्रश्न कुठे? ते ब्ल्यू करू नका सर. हाऊ टू टेल द पोटेन्सी ऑफ द अक्यूज, वेदर कर्सर काढणार नका, कर्सर काढणार कर्सर, हा तो कर्सर बाजूला काढ. वेदर कॅपेबल फॉर परफॉर्म, कुठे गेला तो, कुठे गेला? Sir, just 1 minute.
That's true.
Post
How to test for it.
How to test the potency of the accused, whether capable for performing the normal sexual activity.
Now see, we have a pro forma for examination of accused for potency. That is only related with your physical examination, history taking, and local examination. Now in these three categories, if you could not find anything which would suggest that he is impotent, we have to label him as potent. This is the simple reply.
Okay.
Now, if you go into details, actually, जर तुम्हाला करायचं असेल, then you should take opinion from andrologist, nephrologist, do n number of tests.
Okay.
Then only after this, we can say. But for the best understanding of accused examination for potency, what the examination pro forma says that in your history taking, your physical examination, general examination, and local examination. Now in this, what has happened, factually, we do not have separate rooms or bathrooms for the accused. Now in my setup in Sion Hospital or where we do, I do one of the maximum medical legal workload of Mumbai city. Daily, we do two to three FOXO cases examination minimum.
Okay.
And 2 to 3 accused related with that. That is around 1,000 cases accused and victim examination we do at Sion Hospital, Department of Forensic Medicine. Now what we have done, we have a separate privacy room for this accused. In that you can have some pornography films, photos, and if with your visible eyes, with my visible eyes as a doctor, if I can see the genitals of a male erecting in front of me, then there is no need of any other proof or laboratory diagnosis to be made for me. Because what is impotency? Impotency as per law defines that inability of a person to take part in sexual intercourse. That is impotency. Now, once I examine and in front of me, if the genitals, external genitals of a male is being erected in front of me by some manuals, then it is so obvious that he is capable of doing a sexual intercourse. No need to go for any other test.
But sir, whether it is admissible in court of law?
Why not? We are doing it day in and day out.
What the method you have suggested is admissible?
Yeah, why not? And it should be done, I would say.
Okay.
Now, only taking a history and without examining local parts of the male genitals, if there are reported cases where few doctors are opined without examining the genitals, and in the court of law, this defense lawyer has produced a certificate in which he has said that he has small penis, he has azoospermia, he has dysfunctional erection of penis, and he has given a certificate of psychologist, sexologist with them. So what we should do, to avoid all this, we doctors should be cautious enough nowadays. So पुराना जमाना गया अभी, कोई किसी को छोड़ता नहीं कोर्ट.
सर पण तुमच्या मेथड मध्ये इरेक्टाईल डिस्फंक्शन आहे की नाही हे कळेल, पण व्हॉट अबाउट अॅझोस्पर्मिया?
नाही, अॅझोस्पर्मिया इज नथिंग टू डू विथ इम्पॉर्टन्सी सर.
पॅथॉलॉजिकल टेस्ट ना?
नाही, अॅझोस्पर्मियाचा डिफेन्स कुठे फायदा करतो? जर तुमच्या वजायनल स्वॅब मध्ये जर सिमेन पॉझिटिव्ह आलं, आणि त्या सिमेनचा डीएनए मॅच झाला, आणि देन ही टेक्स अ डिफेन्स, अरे वेअर दिस स्पर्म, हे कसं काय आमच्या अॅक्युजचे, माझ्या अॅक्युजचा अॅझोस्पर्मिक आहे, टेक अ सर्टिफिकेट. जर तो सिमेनच डिस्चार्ज त्याच्यात स्पर्म्सच नाहीयेत, तर हे स्पर्म्स आले कुठून तुमच्या स्वॅब मध्ये? बट अॅझोस्पर्मिया हॅज नथिंग टू डू विथ इम्पॉर्टन्स. हेच कन्फ्युजन आहे आपल्याला. अॅझोस्पर्मिया इज रिलेटेड टू स्टॅबिलिटी अँड प्रोडक्टिव्हिटी. पोटन्सी अँड इम्पॉर्टन्सीचा साधा अर्थ आहे, इफ यू कॅन टेक पार्ट इन सेक्शुअल ऍक्ट, if he is a male, what way he takes part in sexual act? is by his external genitalia, that is penis.
Yes.
And
Very
to take
correct.
part in the intercourse, he need erection of penis. So simple.
Yes.
Flaccid penis cannot take part in intercourse,
Correct.
but flaccid penis can ejaculate. See,
Yes.
these are two different propositions. See, we always feel as a doctor, he cannot erect his penis, so how can he eject sperm? See, even though he has a flaccid penis, he can eject sperm because sperm ejaculation is nothing to do with the shaft of the penis.
Yes.
You know,
Yes.
erection. So this is totally different.
Sir, next question. मला वाटतं डॉक्टर बर्डाले सर असतील तिथे. How will we differentiate if the survivor was raped while she is menstruating?
Sir, by the clinical examination.
Only by clinical examination.
Obviously, sir, during examination, the blood will be oozing. From the presence of that blood, one could differentiate whether the female is menstruating or not.
नाही पण सर मेन्स्ट्रुएशन आणि एखाद्या इंजुरी मुळे ब्लिडिंग होणं.
Obviously, sir, obviously, that blood clots will contain some debris of decidua or endometrium of that particular thing.
Yes.
It have some different smell from the normal hemorrhage.
Okay.
And you can identify the injuries because to have hemorrhage from the vagina or labia majora, we need to identify some injuries. So obviously, we will identify the injuries.
Oh, yeah. So my next question, which sample of the victim must be collected after 96 hours? मला वाटतं आपण याचं उत्तर दिलंय. Blood samples फक्त. Yes. पुढचं काय? As we cannot take the vaginal swab or the smear semen sample during the menstruation. Okay. पहिल्या प्रश्नाचं उत्तर आहे सर. बटाले सर.
हाँ सर.
हाँ. तो पहिला प्रश्न होता त्याचाच पुढचा पार्ट त्यांनी दिलाय तो.
हाँ. During menstruation, it is not possible to collect sample, and obviously after completion of that menstrual period, the biological sample will be washed off. So that is one of the problem with the examination of survivor during menstrual period.
Because 96 hours get elapsed, no?
Yes. Obviously, but we can reduce some sort of injuries if obviously injuries are there. So from that presence of injuries, we can deduce some sort of opinion.
Okay. Chalo next. Okay.
Survivor to be referred to psychiatrist.
Sir, question असा आहे की survivor to be referred to psychiatrist or not?
Invariably, sir, or ideally, she should be referred to psychiatrist.
Oh. Next question, if rape and death under 18, then what microscopic report and PM report are written separately?
No. The column number 15 of the PM report have description about external genitalia. So you can mention the findings of that sexual offenses or injuries sustained to that victim or survivor in column number 15 of PM report.
Okay. And what about the microscopic reports?
Sir, microscopic, because the court will not believe doctor for microscopic examination. So it is always better to refer the microscopic examination sample to forensic science lab.
Okay.
However, for academic purpose, if you want to do, you can do for academic purpose only, but court will not believe you.
Oh. It is a cursor.
If survivor do not want to get examined by the male RMP in fresh case at peripheral facility, what should be noted on police requisition form?
Yes, madam. There is a provision. In fact, the Criminal Amendment Act says that even if the survivor wants to examine at a private hospital, then she can have examination at private hospital. If the survivor wants only examination by female doctor, yes, she can give, deny the consent by examining a male doctor. So that is there. But ideally, you should explain to her that by doing such, you will be losing the vital samples. However, the denial should be recorded and documented.
Sir, next question आधी एक पोस्टची लिंक दिलेली आहे चॅट बॉक्स मध्ये सगळ्यांनी पोस्टचे क्वेश्चन आन्सर करावेत. आपण क्वेश्चन आन्सर चालू ठेवतो इकडे. चलो.
The doctor do the autopsy like cutting body or this sweeper person.
MLC, postmortem,
I'm not able to hear question.
So,
autopsy.
is it mandatory that doctors do the autopsy like cutting body or do this job is sweeper person?
असं विचारायचं की हे जे आहे आपण कट करतो, बॉडी कट करतो का पीएम करतो, हे डॉक्टरनी स्वतः करायला पाहिजे का स्वीपरनी कट केल्यानंतर आपण फक्त एक्झामिन करायला पाहिजे?
Ideally, doctor should conduct postmortem examination. The only role of sweeper is to stitch the body and to open the brain skull cap.
Are we supposed to do spot PM by going on the spot whether the death had happened?
Not able to get the questions, ma'am.
So are we supposed to do spot PM by going on the spot whether the death had happened?
The police manual has clearly mentioned that if it is not feasible to ship the body to mortuary, then spot PM, the provision of spot PM is there in police manual.
But who should open it? Whether the body is in a position to shift it or not?
That's the
either doctor or a police.
Our hospital admission manual or civil medical code do not mention this. However, the police manual mentioned that spot PM you can do spot PM. So it's difficult to opine.
It is again a gray area.
Great, yeah.
Okay, next question.
For examination cases, mandatory documents for medical officer. Is it order from magistrate or just a request letter from police will be sufficient to attend
Magistrate,
examination?
100% magistrate. For examination,
Magistrate inquest is must.
Yes. Sir,
Because-
in my opinion, there are 3 persons are required for examination. Collector, doctors, and some police officer, higher rank.
This a police officer will identify the grave, but the inquest is required by magistrate. Now the magistrate may be sub-divisional magistrate, maybe district magistrate, or maybe executive magistrate.
Sorry, all 3 persons should be there at the site of examination.
Yes, ideally it should be there because the doctor can very easily because doctor have to collect later on samples from the soil beside the grave and from the under the grave.
Yeah. Okay, next.
So next is how to handle odor of decomposed body.
Sir, funny question.
There is nothing to do. Once you get accustomed, you will enjoy that odor.
Just to disseminate that order.
Yeah.
Next.
Cases not seen or came across in PG curriculum, firearm cases, etc. can be a ground or reason for referral to higher institution to get it from expert hands for a forensic specialist. As many of our PG students doesn't get
डॉक्टर पवार सर, हा तुमच्याशी रिलेटेड तुमच्या टॉपिकशी रिलेटेड आहे. असं काही रूल आहे का की त्यांनी केसेस हायर सेंटरला रेफर कराव्यात?
Because Dere sir has answered this question in
Dr.
his
Pawar?
presentation. Yes, sir. Is it audible, sir? Is it audible, sir?
येतोय आवाज येतोय.
Ha. Sir, because Dere sir himself answered this question in his presentation that if it is not feasible for the medical officer or any specialist that it has to be done at his center, it's always better to refer to the concerned specialist because he will take x-rays, he will try to collect the pellets or bullets from the body to send it for forensic ballistic experts for examination. So that is better to refer. Sir, येतोय आवाज?
येतोय सर, येतोय आवाज.
हो
येतोय सर आवाज.
येस.
हो आपणच आन्सर केलं सर, तर त्यामुळे हा प्रश्न घ्यायला नव्हता
नाही नाही असं नाही. ठीक आहे ना सर.
येस सर.
दोघांपैकी पहिल्या मध्ये
नाही सेमच रिप्लाय केलाय सरांनी.
ओके.
जस्टिफाईड आहे.
येस सर.
फक्त इट शुड नॉट बी अ प्रेसिडेंट. बरेचसे मग मेडिकल ऑफिसर काय करतात की आम्हाला हे अडचण जरी नॉर्मल केस आली, टेक एक्झाम्पल एखादी क्लिअर कट स्टॅब आली आहे, हा, आणि ते पीएम ते करू शकतात, पण जस्ट बाय प्रिटेक्स्ट ऑफ दिस की आमच्याकडे एमडी फॉरेन्सिक अवेलेबल नाहीये, याच्यात काही उद्या निघू शकतं. हे फार चांगली उत्तरं असतात मग आमच्याकडे जेव्हा रेफर होतात, दे राईट इन दॅट याच्यात पुढे असं पण निघू शकतं. अरे निघू पण नाही, निघल्यावर बघता येईल ना. ऍटलीस्ट यू ट्राय, यू आर ऑल्सो एन एक्सपर्ट, है का नाही सर?
अच्छा, फक्त आता प्रेसिडेंट आपल्याला डेव्हलप होत येत नाही.
Obviously, na, sir. See, hardly 5% PM are done by MD forensic in this country.
Yes.
मग एवढं तुम्ही शिफ्ट कसं करणार? When you shift from say in peripheral मुंबईत तर ठीक आहे 10-15 किलोमीटर मध्ये मेडिकल कॉलेज आहे. But if you go to remote areas, to go to the medical college, they have to travel for 50 kilometers, 60 kilometers, 100 kilometers. During that transportation, there may be loss of evidence. आणि आपले पोलीस किती बहादर आहेत आपल्याला माहित आहे. मुंबईत सुद्धा क्राईम सीन होत नाही तर तिकडे काय होणार आहे? We also know what are the difficulties. It is better, it should not be a pretext, but this facility should be used with an cautions.
ओके.
रिअली जिथं गरज आहे तिथे करा तुम्ही.
राईट.
कारण जसं मी एक्झाम्पल दिलं.
नाही, एक फक्त सर प्रश्न आहे की विच पीएम रिक्वायर्स द व्हिडिओ रेकॉर्डिंग. Which type of PM requires video recording as a mandatory thing?
As per sir government orders, it's only the custodial deaths, that is National Human Rights Commission orders are there that these custodial deaths are to be video recorded. And the night PM, what we have discussed when you put a question, that all night PM nowadays should be video recorded if you are doing in a critical conditions. Those simple night PMs not necessarily be videographed, but the homicidal cases and the cases in which some law and order situation video recorded in addition to the custodial deaths. These are the latest circulars for us, sir.
इथं नाही.
How to differentiate between strangulation and hanging? Mark per se.
Mark for
Ligature mark.
ligation mark.
Sir?
For ligature mark of hanging and strangulation, मराठीत सांगितलं तर सगळ्यांना चांगलं कळेल की जर पूर्णपणे ती एनसर्कल करत असेल नेकला, it mostly goes in favor of strangulation provided it is horizontally lying. And if it is obliquely running upward and it's incomplete, then it's mostly in favor of hanging. But still the rule is not like this, that strangulation won't be always complete and it won't goes obliquely upward. So it is the observation of the medical officer which matters, but basic findings you can see. If it is horizontal and encircling, it is mostly going in favor of the strangulation, sir.
The next is difference between ante-mortem and post-mortem injuries.
This will come by experience. Antemortem injuries usually bleed, will show some inflammations there. If it is the earlier injury, the color changes will be there. So those findings will certainly absent in cases of post-mortem injuries. The factor of artifacts also we discussed. So that artifacts during transportation of the body also sometimes body bony parts will have the abrasions or scratches. So those will see no inflammation, no bleeding parts, and this kind of things you can take it as a postmortem injury, that too
Right.
as an artifact.
Whether it is compulsory to do X-ray of all body before autopsy in suspected cases if X-ray facility is available at the hospital.
X-rays be done in cases of decomposed body, in cases of firearm cases, in cases where the age is not determined, unidentified body is being brought, decomposed body is being brought. Not in all cases. It is the facility to be used in meticulous cases, meticulously in certain cases only.
How should a skull cavity be ideally opened irrespective of the causes of death?
Sorry, can you please repeat?
How skull cavity to be ideally opened irrespective of the causes of death?
Skull cavity, skull is to be opened by giving the incision to the scalp from mastoid to mastoid, going through the vertex. So it will have two flaps of the scalp, anterior and posterior, and then with chisel and hammer or electric saw, if it is available at the center, then the cranial cavity will be exposed by cutting the skull through that chisel or hammer or the electric saw, what we discussed.
चालू आहे क्वेश्चन आन्सर त्याने गाडीत आहे खाली हे घेऊन येतो
In a fetal skull, it is to be opened.
क्वेश्चन आन्सर चालू आहे काय नेमकं तेच डेस्कटॉप ऐन वेळेस गेली
अरे जरा माईक बंद करा, यांचं माईक चालू आहे. येस, कंटिन्यू सर. नेक्स्ट क्वेश्चन.
Is it necessary to examine intracranial matter and spine in every PM?
Pawar sir.
Intracranial
Matter and spine should be examination should be necessary in every PM.
It is mentioned in the PM report itself in 22nd column that spinal cord is not to be opened in all cases. It is to be opened only in cases of injury to the spine or in cases of spinal poisonings. But the cranial cavity has to be opened in all cases. Whatever the cause you find in thoracic or abdominal cavity, as I said, all three cavities has always to be opened: cranial, thoracic, and abdominal.
In natural or man-made calamity, mass death occur. So how do we prevent such scenario?
सर त्याला जोडूनच माझा स्वतःचा एक प्रश्न आहे सर. पवार सर.
हो सर.
हा, याला जोडून माझा प्रश्न आहे की नॅचरल कॅलॅमिटी मध्ये एन नंबर ऑफ डेथ होता, तर प्रत्येक डेथचं पीएम करणं गरजेचं आहे का प्रत्येक पर्सनचं?
सर, आपल्या मुंबईला पण जे काही केसेस झाल्यात आणि जे आपल्या सोबत जो अनुभव आहे, मास डेथ्स मध्ये ऑब्झर्वेशन, एक्सटर्नल एक्झामिनेशन अँड sample postmortem examination is done rather than doing the n number of postmortems. This kind of practices are adopted. Again, it depends on the situation there and the.
But here, who is going to decide it? Whether district collectorate, district magistrate, or doctor? Who is going to decide?
Doctor will never decide, sir. It's the inquest doing and medico-legal autopsy ordering authority will only decide.
Okay. सर, दुसरा माझा प्रश्न असा आहे सर की पॅथॉलॉजिकल ऑटोप्सी साठी एक्सपर्ट आपण कोणाला म्हणायचं? वेदर फोरेन्सिक पर्सन इज एक्सपर्ट इन पॅथॉलॉजिकल ऑटोप्सी और पैथोलॉजिस्ट?
Sir, let me explain what is this pathological or clinical autopsy. It is to be done for academic purpose. Yes. And in a case, in a non-MLC case, and pathologist only will do the clinical autopsy. It is only done after the consent given by the next to kin or the relatives of the patients who died or who succumbed. And it is only after the attending doctor request that this is needed for some additional information, research, or for academic purpose. And if the relatives consents for it, then only the things will be proceeded further.
सर डेरे सरांना माझे 2 प्रश्न आहेत. डेरे सर आहेत ना?
येस बोला ना सर.
हा सर, प्रश्न माझा पहिला असा आहे की MNC recorded by private hospital is admissible in court of law?
Why not? Every doctor has a right to do an MLC,
Yes.
and that is accepted in the court of law.
Okay. And suppose some medical record of the private hospital produced in the court of law, and in contrast with that, the medical legal case recorded by government hospital also produced in court of law, but both the evidence are contradictory. Then what to do?
Yes. So now in this case, suppose the same case has been examined by a private hospital and it is referred to government hospital for further treatment. Again, it is examined in government hospital, and you say that both these opinion are put forth to the court, and which contradicts or which one, or we can say they are not similar. Now, in my slide, section 147 of Indian Evidence Act says this. Now, in this, it is a discretionary power of the judiciary. Now, both the doctors who have provided opinion, maybe from government college or government hospital or private hospital, they will be called for trial in the court of law. They would undergo the cross-examination, and after that, whatever record on evidence is taken in the court of law. आवाज येत नाही?
येतोय.
Whatever record on evidence after doing cross-examination, chief, is taken on record by the court of law, the judge will decide which was factual and which was more scientific based, considering the facts and finding of the case.
Sir, quickly we'll go for the post test. आपण प्री टेस्टमेंट आणि पोस्ट टेस्ट जे घेतलेले आहेत त्याचे क्वेश्चन थोडे डिस्कस करूया. फक्त आपण ते क्वेश्चन्स लाव. चलो हा सर, हे दिसतंय सर, स्क्रीन दिसतोय? डॉक्टर बडाले सर, डेरे सर आणि पवार सर.
हो, दिसतोय.
आता मी आता रिक्वेस्ट अशी करतो की ज्यांचे जे प्रश्न जे आहेत, ज्यांचे प्रश्न या किंवा प्री टेस्ट मध्ये आलेले आहेत, त्यांनी ते एक्सप्लेन करून जरा लोकांना ज्ञान द्यावं.
ठीक आहे, हे बघून ना.
हा, हे बघूनच.
हो, देऊया.
Procedure code, medical examination of the victim rape is carried out.
My bag was right.
So it is 164A.
164A.
Huh.
Okay. I got the 73% persons are right in the pre-test. Okay, next. For medical examination of the victim of rape, consent is valid if given by the female above
12 years of age.
12 years of age. Okay, 68% are correct. Next.
29.
29%. Oh, sorry. Next. Vaginal swab of the detection of spermatozoa should not be collected if the victim female reports for the medical examination beyond
96 hours.
96 hours. Normally 87% has given the correct answer. Next question is, a 17 years unmarried girl visits the hospital for the medical termination of pregnancy. From whom you will obtain the consent?
Parents.
72% has given the correct answer. A 17-year unmarried girl visits the hospital for the pain in genital area. Her history reveals that 2 days back she had a consensual sexual intercourse with her boyfriend. She requested you that the information should not be given to police as she doesn't want to put her boyfriend in trouble. What do you do? The answer given by 75% is
Inform
police,
police.
inform a diffuser for the police intimation.
Yeah,
Is it correct?
definitely. Yes, yes.
Okay, thank you, sir. Next question is, under section 174 Criminal Procedure Code deals with. The answer given by majority people are inquest. Is it correct?
It is correct, sir.
Yeah.
It is
Okay.
police inquest.
Yeah. Next question, the consent or permission from the legal guardian of the deceased is necessary for.
So just now we discussed, it is the clinical autopsy or what called as pathological autopsy.
Yes. सर हा क्वेश्चन फार महत्वाचा आहे कारण फक्त 20% लोकांनाच करेक्ट उत्तर द्यायला याच्यात.
नाही आपण
मी तो
कन्फ्युज
प्रश्न
असतो सर की पोस्टमॉर्टम करण्यासाठी सुद्धा कन्सेंट पाहिजे नाही. पोस्टमॉर्टम नॉर्मली म्हणजे मेडिकोलिगल ऑटोप्सी, पण त्याला कन्सेंट नको असते. ती फक्त क्लिनिकल ऑटोप्सीला ज्याची नाव पॅथॉलॉजिकल ऑटोप्सी त्याला पाहिजे असते.
So my next question is, the objective of the medicolegal autopsy is to find out, to establish, to find out. 93% people given the answer all of the above. Is it correct?
It is their favorite answer that all of the above, and that is correct. Even most of the medical officer knows why they are conducting and why it is necessary. Yes, sir, they are correct.
जगात गोळी मारली बरोबर लागली.
खरंच sir.
Okay. Next question, certain obligations of the part of the doctor who undertake the postmortem examination are following, except the examination routinely record, keep the police informed, or he must preserve. The answer, maximum answer given 60%, he must keep the record informed through the finding. Is it correct?
He must preserve viscera and send for toxicological examination in cases of poisoning, sir.
Okay, it is only 18% then. That green area shows the 18%. म्हणजे आता ह्या 2-3 प्रश्नामुळे आपल्या वेबिनारचा फायदा होईल असं वाटतंय.
No, sir. 1 minute. I'm not able to get the question.
Certain obligations on the part of the doctor who undertake the postmortem examination are following, except तर त्याचे आन्सर असे दिले आहेत, examination should be meticulous and complete, routinely record all the positive findings and important negative ones. तिसरं आहे, he must keep the police informed about the finding and he must preserve the viscera and send to the toxicology.
No.
Except कुठे आलंय सर?
First, second, and fourth is correct, except he must keep the police informed about the findings.
Yes. म्हणजे मेजॉरिटी लोक बरोबर आहेत सर.
Yes,
I'm
sir.
medical sir, I'll incorrect. Thank you.
Yes, sir. They are
Yeah,
keeping.
I will go for the last question. Last question is for the histopathological examination. The tissue preserved in formalin, glycerin, rectified spirit, and sodium chloride. 73% has given the answer, 10% formalin. Is it correct,
Again,
sir?
they are very correct, sir. Correct, sir.
Okay, thank you. आता पोस्टने सगळ्यांनी द्यावी. I am very happy that nearly 280 people have given the pre-test. I hope that majority will give the post-test also, so we can see the result of the webinar and the merit of the what we call as our resource person. Thank you very much, Dr. Badale sir, Dr. Pawar sir, Dr. Dere sir. आणि मी एक मला कमिटमेंट पाहिजे की मी याच्यावर एक वर्कशॉप घेतोय पुढच्या महिन्यामध्ये 2 दिवसाचं फिजिकल, मेनली सेक्शुअल असॉल्ट रिलेटेड गोष्टीवर. तर आपण पार्टिसिपेट करून आमच्या ज्ञानामध्ये भर घालावी असं आताच मी रिक्वेस्ट करतो. नंतर फॉर्मली बोलूनच आपल्याशी.
थँक्यू.
थँक्यू व्हेरी मच.
थँक्यू सर.
ओके,
थँक्यू ऑल मेडिकल ऑफिसर्स.
थँक्यू ऑल मेडिकल ऑफिसर्स.
थँक्यू. Should we leave? Should we leave now?
We are also
With the
leaving
kind
now.
permission.
Thank you very much.
Thank you.